Okay, I have several announcements this evening, so please bear with me. First, I would like to welcome all in attendance and all on the Zoom and remind everyone again that to please be respectful of your neighbor. We will hold this meeting in an orderly fashion, just as we did last week. The Springford School Board does believe the community has the right to bring before the board issues and concerns that they may have about items on the agenda or about things in general which affect the district or their children. Because of this belief and philosophy, the board will open an opportunity for community members to share their concerns with the board. Typically, at the beginning of each board meeting, the Springford residents have an opportunity to share concerns and comment about items, specifically on agenda items only in the beginning. Each community member will have tonight up to 3 minutes in which to address the board. Community members joining us on Zoom who would like to make a comment should use the raise hand feature when prompted. Individuals with their hand raised will be called on during public comment and will be asked to unmute themselves before speaking. Just to note that tonight, I just want to be fair to everybody, we usually always go first in the room. Tonight, we're going to flip flop. We're going to let the people on Zoom go first, and then the people in the room will go second, and each group will have 1 hour. So if you're not going to use your whole 3 minutes, please be conscious of that so that if there's any time left over, that may give an opportunity for someone else to speak. Last week, there were 7 people, I believe, on the Zoom and 5 in person that did not have that opportunity. So let's be kind and respectful of everyone. So tonight's format is going to be slightly different to allow for Mr. Rizzo's presentation of a modified plan before public comment. Please also note I have requested to include the positions of administration, nursing staff, and SFEA. Ironically, I have been the one all along to include input from these 3 groups. In fact, I asked for Trish Smith to speak at our meetings. So I do apologize publicly for my misstep last week. There was a whole lot going on, and I do believe it shows my humanity because that was an error, and I would have liked for Ms. Smith to speak before there was any voting that was done. So also, public comment will be held after the presentation and prior to the vote. So that is the way it's going to go this evening. In this way, we hope to present an alternative that will begin to unify our district and keep our children in school. After Mr. Rizzo's presentation, as I said, we will have some board comment and then public comment and then the vote. Please remember that in order to meet the requirement of Pennsylvania's Sunshine Law, it is necessary to record the name and address of all Springford residents who speak during public comment, whether in person or on Zoom. I do suggest to, again, move things along in the room, that as you come up to the microphone, you say your name and address, speak your comments, and when you're finished, take the clipboard, move aside, and put the information on the clipboard while the next person comes up. And that way, I hope to minimize a delay between speakers and maximize the hour in the room. This meeting is being filmed to be broadcast on community cable channels and online. Individuals intending to speak to the board should be aware that they are being videotaped. The board will do all it possibly can to assure each member of the community has an opportunity to speak on issues. However, if a large group of people wish to discuss a specific topic, the board reserves for itself the right to limit participation and total time allocated to that part of the agenda, as I just did. Once the public comment on agenda items is complete, only board members will have an opportunity to speak on issues on the agenda at that time. However, the chair may, at its discretion, permit discussion on selected items as the need arises. Finally, I respectfully again ask that those individuals in attendance this evening are respectful, courteous, and civil during public comment and throughout this entire meeting. So a few more announcements before we get into our agenda this evening. And those are that we did have an executive session prior to this meeting regarding personnel this evening and legal. And then also Dr. Wright is on the Zoom. She is joining us on the Zoom this evening. Do our student reps have any announcements this evening?
There are no announcements this evening.
Okay, thank you. So then our next step, as I said, is going to go to Mr. Rizzo to present an update to Springford's health and safety plan.
Check. Okay, well, good evening. Thank you for allowing me the opportunity to speak. As Mrs. Osowski mentioned, as the week progressed last week and some COVID numbers rose a little bit, and we received some feedback from some community members, and quite frankly, the polarization of our community on the topic of masking, we did have a conversation about, are there other options that are out there? So we did continue, as we always do, to see what other communities are doing, what other school districts are doing. So we're going to be bringing forward an option for the board to consider that does hopefully try to pull our community together in some capacity, knowing that not everybody is going to be happy all the time. But in the end, we should all align ourselves behind keeping students safe. So think of the proposal tonight as sort of like a two-pronged approach or a two-phase approach. So the first phase is the first 4 weeks of school. The idea behind the first 4 weeks of school is, let's get students in school. Let's get some time in to see what happens with our data. What I have heard and have been hearing from the experts that you would say Montgomery County Office of Public Health or CHOP are saying that this spike that we're seeing is a temporary spike, and it's a 3 to 4 week type spike. And then we should see numbers begin to diminish again. This allows us the opportunity to see if it trends the way that they're suggesting or not, while providing an opportunity for our students to be in school and again to try and minimize any quarantine, which is kind of one of our main objectives here, to keep students safe and to keep them in school. So when I did meet with our leadership team, and I met with our nurses, and I met with our administration, and I met with our teacher association, and one of the things that we are all completely on the same page about is we need to keep our schools open. We need to keep our students in school. So that is the lens that tonight's presentation is going to take. So again, for the first 4 weeks, which begins on the first day of school and goes through the week of our work session meeting, September 24th, we are putting out there a mandate for masks for kindergarten through 6th grade for staff and students. We are putting out there optional, not optional, but more recommended, where we are still going to encourage masking for grades 7th through 12th grade for staff and students. At the K through 6th level, we would be asking for a form, a parent waiver, so that we know exactly who is and is not going to be masked. An important part of what we are legally required to do is contact trace. So knowing who does and does not have a mask on does impact whether a student ends up being quarantined or not. So that's information we need to have in our system so that we can be accurate with our reporting. This will be in effect if we are in low, moderate, or substantial spring forward transmission. I want to bring attention to this because, as I mentioned last week, we had the benefit of being both moderate, substantial, and high all in the same week. So we had to decide which data set we're going to use. Our recommendation is that we use spring forward numbers because that is a community that we are obviously more closely associated with. So spring forward numbers are generated from Montgomery County Office of Public Health, which is driven by the information they get from Pennsylvania Department of Transportation, Department of Health. So in low, moderate, or substantial, this would be the case. If we would go to a high level of transmission, then we would mandate masks K to 12, again, only with medical exemptions with a physician's signature or medical professional signature. That would be what I would call the first phase. The second phase would begin Monday, September 27th. And again, we would be reevaluating on September 20th at our board meeting, on our work session, to see if this is the appropriate course of action or not. At that point, we would switch to what I think would probably be the standard. If they're in low or moderate, then we would recommend masking for staff and students. If a family would choose for their child to not wear a mask, then again, we would want that waiver form to be submitted. If we're in substantial, K to 6 would be mandatory, and then 7 to 12, we would once again recommend. If we go into high transmission, like we did in the first phase, it will be mandatory K to 12 with a medical signature as the only exception to that rule. Transmission level shift. This was initially I guess, brought forward by Montgomery County, and that's to avoid the back and forth each week. They identified a level of transmission as 2 consecutive weeks of data that are consistent. So if we're substantial 2 weeks in a row, we would then shift to substantial until we have 2 weeks of a different transmission. And that minimizes the yo-yo effect of masking, not masking, high, low, or moderate. And again, if there is ever a mandate from the CDC, PDE, Department of Health, or Office of Public Health, we would follow that mandate. We would follow that mandate. And a reminder, I just want to talk about mitigation strategies because I did read a lot of emails this week. And I responded to as many as I could. But some of the things that are out there is that we're not doing any mitigation strategies at all, and that's not accurate. Montgomery County Office of Public Health, in their guidance to schools, states when it's not possible to maintain a physical distancing at least 3 feet, such as when schools cannot fully reopen while maintaining these distances, it is especially important to layer multiple prevention strategies. These are things we're talking about masking now, specifically indoor. Outdoor masking is still a thing that we're not pushing, we're not asking for. There is still some discernment. If we're in a large clump of people and we're outside, you might want to think about masking if we're in a higher level of transmission. We're talking about screening testing. There are 3 types of testing that we here at Springford want to support. Assurance testing, which is essentially ensuring or assuring that our students and our staff that are well continue to be well. Symptomatic testing, as we start getting into different seasons, if somebody is symptomatic, instead of just saying, yeah, that's kind of like COVID, you need to go home until you get a test, we can now test in school, and if they test negative, then they can stay in school. And then testing out of quarantine, which is anywhere between that whole day 5 and day 7 of the quarantine, then you could test to come back after day 7. Those are, that's Project ACE-IT, which is done through Montgomery County Office of Public Health in partnership with CHOP. We do cohorting at the elementary level. Our students stay with each other, improving ventilation. Mr. Hunter could speak to what the efforts they've done on that. We again continue to push respiratory etiquette, hand washing, covering cough and sneezes. We do encourage families and staff to stay home when they're sick if they're symptomatic. Regular cleaning, our cleaning efforts have been above and beyond, and it will continue to be that in our evening cleanings, and as we have identified cases. And again, we're working towards minimizing visitors into buildings while we have higher levels of transmission and starting out our school year. Just to kind of give you an idea of kind of how things evolved, all through last year we had 3 levels of transmission. We had low, moderate, and substantial. Low defined as 0 to 9, moderate 10 to 99, and substantial 100 plus. In the spring this past year, we started hearing of a 4th. So just wanted to show you what it was and what it is in the comparison. So essentially, the current moderate and substantial is what last year's moderate was. Low is the same, and substantial is now the new high, just so you can kind of see where we are. Based on the information that we have received, the most current information from Montgomery County and from Pennsylvania Department of Health, Springford's transmission is 52.93 per 100,000, or 4.07 PCR positivity. That makes us substantial. And Montgomery County transmission as of this past Friday, 74.7 per 100,000, or 4.7 PCR positivity, also substantial. And just kind of as our air and crew retooled our dashboard, our COVID reporting dashboard. So I'll give you a screenshot of what that looks like, and we will keep that updated. That's what it looks like now. It is live on our page, so you can visit that now and see, as we update that, you can see the most current data and information. Reminder, I want to talk about quarantine because a lot of questions came up about quarantining and what are we going to do with students who miss 10 days of school. And the fact is that students really don't miss 10 days of school when they're quarantined. And I think it's important to be clear. So I did run this by our nurses to make sure that I had our timeline accurate. So I'm going to read through this. There's a lot on here, but it's to try and kind of build a picture for you. So you have 2 students in school, student A and student B. One is masked, one is not masked. If they're 3 feet apart, they are 3 feet apart. They're in school on Monday and Tuesday, and both of them are asymptomatic. They feel fine. Wednesday, one student develops, I say COVID-like symptoms, but you know, COVID-like symptoms can be almost, anything that is also related to the cold. They develop symptoms. They become symptomatic. Thursday, they go get a test, and they find that they are confirmed positive. On Friday, the parent notifies the school of the positive result. Contact tracing goes back 48 hours from the test or when the student became symptomatic, which in this case was on Wednesday. And it's important to mention here that if both students are masked, it's a different situation. If students are vaccinated, that's a little bit of a different situation. So day one of quarantine is the first day after the last day of exposure. So in our example, the student became symptomatic. The last day that student A, for example, was exposed to student B was Tuesday. Wednesday becomes the first day of quarantine. We find out about this on Friday, so it's already day 3 of a 10-day quarantine. We then exclude that student as of Monday, which is now the 6th day of quarantine. So then the student, if they choose to do a test out of quarantine, which they can do in our schools, if they choose to do a test out of quarantine, then they can come back after day 7, which means Wednesday they would be back in our buildings, and they would miss a total of 2, maybe 3 days. If they choose not to participate in the test out of quarantine option, then they would miss approximately 5 days of school. So 10 days doesn't necessarily mean 10 days. Does it mean that we need to not worry about our students? No, it doesn't mean that at all. It just means that the amount of time actually missing instruction, missing live instruction, is a little bit less than what the 10 days might suggest. And just another, the CDC order that I believe, and Mr. Fitzgerald, you could probably opine on this a little bit more. It does require that public transportation, including school buses, masking is required. And again, only medical exemptions with a medical signature would be honored in that situation. And that's the general gist of kind of what we're proposing as an option to keep our schools open and our students in school. So I'll entertain questions.
Bob, Mr. Rizzo, could you explain the difference between the two exemption forms?
So the parent waiver form would be, okay, we are recommending masking. And as a position of our district, we are recommending masking. If you are going to not mask your child for a non-medical reason, we would just have a waiver form where say, if you choose to not mask, just know that you could be quarantined, that this would be, this is kind of maybe some of the risk or whatever, and then it would be a parent signature submitted, and then that would be it. It would be done. In fact, we're talking about doing it through Skyward, so it could be done digitally. A medical exemption would be very similar to the form we had in place last year, where we would ask what the medical reason is, and then we would ask for a physician signature or a medical professional signature on the form.
So low and moderate, it would just be the parent, what's the word?
Waiver.
Parent waiver form.
It's the parent waiver form, doesn't require medical signature.
It will be low, moderate, and substantial for 7 to 12.
Right. And then if it's masker required K through 6 or K through 12, then the medical exemption form would be required with the medical signature.
Correct.
And also, when you're going through your numbers, currently, if whoever didn't add high into the mix, we would be moderate today if we're still using last year's criteria.
If we were in substantial now was moderate last year.
Right.
Yeah.
So we're substantial this year because they added high and pushed substantial down. But last year it was moderate. So looking at last year's criteria, we would be considered moderate today.
Correct.
Correct.
Yes. Are you on that screen now? Yes, because we're at 52.93. So that would be last year's moderate.
So you're proposing mandatory K to 6, but if the numbers go down, we make that optional if they go down.
We would still recommend masking.
But
And again,
That's
a lot of
optional.
concern about the vaccines becoming available for students under 12. Once that becomes available and there's a choice involved, then I think we probably have a conversation about that.
even if it's low or moderate, if there's enough transmission going on and you're getting a high number of kids who do have to quarantine and there's a lot of lost learning, is it something you would think about going back to fully masking so
So
that we have
ear-
more kids in school?
That's a great question. And early on in the summer, I shouldn't say early on, I should say the latter half of the summer when we were meeting with Montgomery County, one of the things they were discussing doing was being strategic with when you choose to use masks. So in the event that you might have one or two students in a particular classroom that test positive, then maybe those close contacts, you tell them they need to mask for a week or two until we find out that they're, asymptomatic or they don't contract COVID. Or you do a whole classroom. So being more strategic with how you use masks instead of just everybody wears the mask thing. So would we be willing to entertain it? Sure, of course. Whatever we need to do to keep our students in school.
Mr. Rizzo, Mr. Rizzo, thank you for the presentation. Just for clarity, this presentation was presented to Nurse Smith and her staff, the administration, and the teachers union.
So yes, I meet with Trish Smith and Laura McNeil, who are the nurse department heads, and they reach out to their staff. So I didn't meet with their staff, I met with them. And the same with SFEA. I meet with Mrs. Ritter, and she works with her executive council. But I did meet with the whole administrative team.
And they were in support of this approach.
Yes, I actually have a statement for Trish if you'd like me to read it this time, and I know Mrs.
Please
Ritter
do.
is also prepared
Please do.
tonight as well. Okay. It's a little bit lengthy, if you know Trish, that makes sense? Yep. The CDC and health departments have given schools an opportunity to keep our children in the classroom during an ever-changing pandemic by easing the distance mitigation effort to 3 feet apart and relying more on the effectiveness of masks. This prevents the healthy students who are close contacts from being sent home to quarantine if everyone is masked. And really, this is Barbara Zone, not Trish. Last year, we quarantined approximately 2,000 healthy students. They never got COVID. We quarantined about 2,000 students. So we did quarantine a lot. So that's the lens Nurse Smith is looking through. Last year, we were forced to quarantine many students, the vast majority of which never developed the illness. This caused great anxiety and strain on the students, parents, and teachers, and the incredible disruption to education. Without consistent mask use, we will be required to contact trace and quarantine our exposed students the same as last year. We don't want to send healthy students home anymore. If masks are mandated, contact tracing is cut and dry. As long as no student was within 3 feet of the infected person for greater than 15 minutes, close contacts remain in school. Only symptomatic students get sent home. We eliminate quarantining from the equation, and we keep healthy students in school consistently. If masks are optional, the process of contact tracing does become more complex. We have to determine the start of the infection for positive persons, determine close contacts, that process that I explained to you earlier. And then we determine if the individual was masked or not. If not, then there's a quarantine. If they were, then they may not need to be quarantined, but they should still be symptom monitoring. Then we must be reasonable about our ability to track which students are wearing masks and when. We cannot micromanage this, but we do have a plan through Skyward to be able to know who was and was not masked. The nurse's recommendation says, let's have the numbers dictate the rules. The greater the community incidence, the greater the chance we have positive cases in school, the more students potentially exposed. For this reason, we support mandating masking, meaning only exemption is with an MD signature if the county is in substantial or high transmission, which is at 50 plus. Once our community is at a moderate or low level of incidence, less than 50, we go mask recommended. We'll have a far better chance of avoiding quarantine when there are fewer positives. That's Nurse Smith's statement.
Thank you.
Yep, and Mrs. Ritter?
Hi, how are you? Mr. Rizzo reached out today and let me know that you guys wanted to hear where we were, and our focus hasn't changed. We just want the kids with us in person. The data from last year tells us that our kids thrive academically, socially, emotionally when they are in the building with us. We haven't, our perspective hasn't changed, our focus hasn't changed. We just want them, we want them here. And whatever plan keeps them here, That's what we want.
So if the masking, because of the quarantine issues, right? We don't want to quarantine healthy kids. If the masking is there so that they don't have to be quarantined, your group will support that to be able to keep more of them in the building. It bothers me that last year, so many of them were quarantined and out of the building. When, in full honesty, I'm still in the corner that we shouldn't be doing this. But if that, no, please wait. But my bigger concern is that I don't want to see healthy kids quarantined because of the quarantine rules or laws that are in play. So as much as I feel that last year we complained about the different groups pushing down on us, and we weren't going to allow that to happen, and by recommending their recommendation, we were kind of handing it back to them, I feel like they're forcing our hand. Because if we don't do this and they have to quarantine, we're going to have too many kids out of school that don't need to be out of school. And mind you, they're not going to have virtual school. They're going to have Wednesday every day. And I don't know that that's good for our students. So what I'm hearing is SFEA would support the masking, at least maybe on the tiered approach or dictated by the numbers to get them in school and keep them there. Is that correct?
Whatever keeps our kids in the buildings. We need our kids 5 days a week. We need them in person. The data that we collected in the spring proves that. They're better with us.
Absolutely.
They're healthier with us.
Ms. Ritter? Oh, go ahead. Sorry. Do you foresee any staffing issues based on this approach?
Staffing issues?
Well, either or. That's fine.
There's always the risk that we're going to be short on staff, but I think we're going to be in a good place. Nurse Trish and Ms. Lees have been having conversations about how to manage the contact tracing piece, how to manage some of those things. So we're working on that if there's a need. So Ms. Lees is aware. I don't think at this point we're going to have a staffing issue other than what we normally have each and every year at the beginning of the year.
I'm sorry.
Thank you.
I have actually a couple of questions. First, what is special about September 27th? It just feels like a very arbitrary day. It kind of feels like let's do something and appease a group and then change. So I'm just trying to understand what.
Sure. No, that's a good question. Actually, it was a suggestion from a few people that reached out to me that they identified another school district that was doing something a little bit different. I looked at it as far as how long. I picked that date because we were going to have a board meeting on September 20th, and we have received a little bit of criticism in the past over making decisions and voting on things after 10 o'clock at night and having them take effect the next day. This gives us an opportunity to have a conversation, knowing that there's not going to be any changes that week so that families can prepare for the following week when we revisit this. So it was really more of a strategic, give us time to talk at the board level and communicate with our families and really anything else.
Yeah, I think I'm concerned about, one, about the timing, but also, and again, then September 27th, we then have a board meeting that will go till 10 or 11 o'clock at night, and potentially, new data is received and it shifts things. My concern is certainly for our families, when we look at adjusting masking based on the levels and kind of having this variable, to me, it's very, quite frankly, okay, so is the new data out? What does the last 2 weeks look like? Do I have to send my kid with a mask tomorrow? Do I not send? What is, it just feels like it's going to be a roller coaster and very difficult to manage and to remember and to keep up with. And I think creating some stress and anxiety throughout our community. And so I'm a little bit concerned with the model as it stands. I feel almost more like we would better serve ourselves to, kind of go through the first marking period with a model, and as we did last year, reevaluate that model kind of as we approach the end of that marking period, so that there's just some more. 4 weeks isn't that much time, especially when you're talking about some of our younger students who are just trying to get into the swing of things, and then all of a sudden there's another change, and it concerns me. With that, I do have a question on your presentation. So what I understood, and these are my words, and please correct me, what I'm understanding really is this first 4-week period, masks are required for everybody. However, kindergarten through 6 would require a medical waiver, and 7 through 12 requires a waiver, whether it's a parental waiver or a medical waiver. But masks are mandatory without a waiver. Is that true?
Correct, yeah. I mean,
Because
you get caught up in semantics, but correct, yeah.
Right, so if you don't have a waiver, masks are mandatory. So the baseline is masks are mandatory, kindergarten through 12, and then,
No, what we're actually, I mean,
that's how I'm reading the presentation. So that's why I want
yeah,
clarification, because,
the presentation said for when we're in substantial, it says that masks are recommended 7 to 12, and if you're going to opt out of wearing a mask, you would need to submit a waiver form that is only signed by the parent.
which really means they're mandatory, and if you get a waiver, then they're not, then it's an option. I mean, it's an option to the family, right? It's so the choice is there, but the baseline is, so I just wanted to make sure I understood that correctly.
They're optional from 7 to 12. And,
Only if they have a waiver.
but it can just be a parent form.
I understand, that's what I said. Not the medical waiver. I said they could have either one at 7 through 12. So kindergarten through 6 is medical only, 7 through 12, it would be either parental or medical. As long as they have a waiver, then they don't have to wear. So
I think there's a difference, though. There's a medical exemption form, and then there's a parental waiver. A parental waiver is more of simply a notification for the purpose of our nursing and our staff to be able to do efficient contact tracing. So, I mean, you can look at
either
it,
way,
it's
it's
6
still
or
the
one
same
half. I
thing,
think
right.
it's 6 or
You're
one half
saying-
dozen
okay,
of the other.
It's the same thing, okay. Thank you. And then I think those were my couple questions just on the presentation and making sure I was clear on everything. And thank you for sharing the statement from Nurse Smith, and thank you to Mrs. Ritter for presenting on behalf of SFEA.
I just had a question about staffing, and probably this is more 7 to 12, especially if we're having the younger kids masked to begin with. But if we have breakthrough, which we've been having for some vaccinated, as the numbers get higher, is this something that our subs can handle, and we have enough staffing in case teachers have to quarantine? Or
I could probably let Ms. Lee speak to it a little more than me, but I would say that she's been very proactive in securing building substitutes to allow for a buffer in case we find ourselves in a situation where staff do end up being quarantined. We are encouraging our staff to stay 6 feet away. The guidelines that have been provided to us say that the 3 feet exemption, and that's what it's called, a 3 feet exemption from close contacts, only applies student to student. And that's, I think, where some of the confusion comes in. If you think of close contacts as the traditional definition that has been in place since this began, 6 feet away for less than 15 minutes, that is still in place. The only difference is an exemption between students. If both are masked, they can be between 3 and 6 feet apart. So we are encouraging our staff to stay 6 feet away, to not put themselves in a situation where they could be a close contact or could potentially transmit.
Mr. Rizzo? Yes. So first off, I would like to, thank you, one board member's opinion. I think the collaborative approach that you took with all the major stakeholders within the district resulted in something that I feel, is much different than, let's say, however we got to where we got to last week. So I think it's also fair to say that unless masks are mandated forever and ever, you're going to have a few board members that are just going to not agree with whatever's put forward. So to me, this is a very, I'd say, healthy compromise. And I appreciate the work that went into to getting here, and thank you for it.
Ms. Melton, I just like some clarity. You're okay with the program, the approach, if it's more than 30 days, 60 days, 90 days is?
You know, I just was trying to understand with this September 24th, September 27th, it just feels very arbitrary to me. It feels very, I don't know, it didn't really sit very well when I read it. It felt a little bit like it was, you know, quite frankly, it felt like it was a placating kind of inaction on the part of administration, and I was struggling with that. I don't think that that was necessarily the intent. It just felt that way because it was just felt like a random date out there.
So
I can appreciate that.
And I appreciate your explanation. I'm still processing.
So 60 days would be better? I'm just trying to understand, is it the timeline or is it the content of the presentation?
I was asking a question for clarity. I was trying to understand if there was a reason that that date was selected. Is there something that's supposed to change? Is there something expected to happen? Is there something anticipated in that timeline that would warrant this, you know, kind of shorter window? I do think, you know, certainly, you know, for children, consistency is important. And when you continue to change things every, you know, in 4 weeks and then potentially every 2 weeks thereafter, I think it becomes very difficult for children. I think while they are resilient and they will adapt, I think there's also a level of consistency that's really important for children in creating a safe environment in which they can learn and thrive and develop and grow. I just, that's my opinion. So I'm processing that information and trying to see where I fall.
But Mr. Rizzo, did you not start the presentation off with the reason why you picked that date was with talking with the county, that this Delta variant spike is predicted to be on the downward within that time frame?
So we are the answer to your question is yes, but what we were told was we'll see sort of like that spike happen around the first week of school, which I believe for a lot of districts outside of Montgomery County is this week. But then it's a sort of a 3 to 4 week, and then you see it go down. We are seeing our numbers over the last 3 weeks. They have gone up, not appreciably so, but they have gone up. And so the 3 to 4 weeks to me seem like a reasonable amount of time to see what happens if they level off, if they start to decline, or if they continue to rise. And then that gives the 24th, is just it gives the board time to consider 4 weeks of data on the 20th to make a decision for what's going to happen on the 27th if we're not ready to move out of phase one.
So, a couple questions. One is that I just want for clarification purposes, Mr. Fitzgerald, has the CDC mandated anything as of today related to mask wearing? Other than the school buses?
Okay, the school buses, we view that as an order. And they noted that and separated that as an order. But to your question in terms of masking in schools, it continues to be a recommendation from the Center for Disease
Did the state come out with any any mandates for masking in school as of today?
Again, unless something came out in the last hour or so, I'm not aware of any mandates from the
So
state.
the Pennsylvania Department of Health hasn't mandated anything in your knowledge?
For the school systems, no, I'm not aware of anything.
The Montgomery County Board of Health come out with any mandates as of today related to school masks in school, mandating masks in school?
Again, they've not mandated. They have guidelines which they are recommending it, and they're looking to the Department of Health and to the CDC. But there hasn't been any differentiation of like an order from.
Right. So they're all still recommending.
As of now, yes.
Right. Did the county commissioners come out with any recommendations, i.e. Val or Kush?
I'm not aware that any commissioner or commissioners that have to act as a body has come out with anything.
Okay. So, and Mr. Rizzo, with the county coming out with their contact tracing, have they provided any studies or evidence other than we quarantined a lot of healthy kids last year. But is there anything that's supporting this recommendation from the county as far as contact tracing within 3 feet versus 6 feet versus mask, unmask?
No, towards the end of last year, the CDC did enter a couple of our Montgomery County districts and started to collect some data on 3 feet versus 6 feet and whether one was safer than the other. They did report out on that last week a little bit to the superintendents. Relatively inconclusive were the results. Other than that, aside from some of the, Dr. Rubin he talks a lot about studies and about some of the things that are going on, but there's nothing concrete that I have to correct at that point, yeah.
Right. Just for instance, if we stuck with the current recommendations of everyone that I just mentioned, and students were not wearing a mask and they had to be quarantined, we could still, based on the lack of evidence or lack of anything, we could once again be quarantining healthy kids.
We could be, yes.
And that's where I have an issue, and that's what I mentioned earlier. I also want to go back to the survey. Just like the survey is one piece of the puzzle, and I really just want to put that out there. It is one piece of a very large puzzle. And we did surveys before, and we didn't always sit up here and say, well, the survey says this, so we're going to do this. And we didn't do that this time because, again, it was one piece of a very large puzzle. And maybe we didn't make that clear, that we were looking at it as only one piece, but there are a lot of different things that we've looked at to come to the different decisions that we've had. The times that we have to change course, a lot of it has to do with information that floods us. We do try to share that out as much as possible, and during this crazy world that we live in, it's not always possible to get everything out, and not everything is received or heard maybe in the way that it is intended to be received or heard. Not blaming anybody, I'm not blaming the parents, I'm not blaming us. I'm saying that sometimes it just happens. I will say that we also received the most emails we've ever, I think, received in the course of this last week. And I do appreciate, I for one will speak for myself, that I appreciate the information that came over. Certainly information that was presented in a positive way, because people remember you catch more bees with honey than you do with venom. So it's that some of the emails were very caustic, and we have to balance that, we have to hear that, but please know that we read your emails and we hear you. And that is why we're trying to do something where we have all the stakeholders and everybody together and try to do something to unify us, because this has to stop. So the division has to stop. Although I will say that I personally am still in the position that we are not abdicating our responsibilities up here. Rather, I feel that there are other people that are governing entities, that are experts, that are paid legislators, that should be making those decisions. However, we did hear from, I personally did hear from Cerisi this week, from Mr. Cerisi, asking what he could do to help, while others that had sent letters and such were more encouraging us to do something. So that goes either way. But here it is, it's on our lap, and the quarantine of healthy kids is going to force us to do something more to avoid that. I think this might be the perfect scenario for that. Although I still worry about lunch, because how does COVID know it can't get them during lunch, right? I don't know how that is, and that's going to be something that we're going to have to deal with. That being said, those are my comments on. And Mr. Rizzo, thank you.
If I may, just one more question. So if in the event, and this is just something that, obviously for students that are eligible for vaccination, if a student is vaccinated, will they have to be quarantined?
No, they will not, unless if you're vaccinated and you're a close contact, you are not quarantined. You are encouraged to symptom monitor them.
If they're symptomatic, they would have to.
Correct. If they're asymptomatic, no. But if they are, then they would have to, yeah. Thank you.
Is that the same for teachers as well?
Yes.
I would like to ask a clarification question on that. If you're unmasked and fully vaccinated, would you still be exempt from the quarantine as a close contact?
You would be,
Okay, thank you.
if you're asymptomatic.
Yes.
Are there any other questions or comments from the board? So, Mr. Fitzgerald, I believe we're going to turn it over to public comment at this point, and we're going to start on Zoom this evening. I'm trying to balance comments in the room and on the Zoom. We'll start with Zoom this evening, and should we exceed 1 hour, we'll then turn over to in person. Aaron, are you ready to go?
We're ready. Deborati Roy, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Hi, this is Deborati Roy from 203 Holstein Drive, Collegeville, PA. My comments are about Agenda 2A. We are all very excited, although a little nervous, about the full steam reopening of Springford area schools with in-person learning starting next week. Our primary goal right now should be to keep our kids in school and not out of it. For this to happen, just as the highly transmissible Delta variant of COVID-19 is surging through our area, it is important that we use all possible risk mitigation strategies available to us, namely distancing, good ventilation, hand hygiene, and universal masking when indoors. Hundreds of signatures collected via an online petition supporting universal masking in Springford schools K-12 was sent to the board members today early morning. And in response to that, one of the respected board members mentioned that there is another petition asking for masks to be optional in schools and has similar number of signatures. So who should they support? With all humility, I will like to add that this is not a popularity contest. In fact, it is actually sad that we parents have to write up petitions like this because the school board was unable to take tough decisions last Monday. I feel we are all on the same side, or rather we all should be. The invisible COVID virus is our common enemy here, and we can only beat it collectively and not via individualistic ideas. Please also note that the differentiating factor between grades K-6 and 7-12 grades are just vaccines. But data available on Montco website is not showing very high vaccination rates among adolescents. Actually, ages 10 to 15 is only about 30% fully vaccinated, and ages 15 to 19 is 57%. Different policies regarding masking in K-6 and 7-12 really does not make much sense right now, at least in the beginning of the school year, till you have more data on vaccination status. Unfortunately, the compromise looks more complicated than it should be, and the motivation behind it does not look logical. For most kids, mask optional is equivalent to no masks at all, especially for teenagers in grade 7 to 12. For masks to work as an effective mitigation strategy, the compliance rate has to be really high. Mask optional does not cut it. Most private schools in our area that successfully conducted in-person learning last year had one common denominator. They followed universal masking indoors. I toured one of the oldest school buildings in the district today and was reminded how closely kids will be sitting in the classrooms and move around the building. With about 650 kids and more staff per grade, I'm not very optimistic about the longevity of in-person learning without universal masking in all grades. For everyone who is concerned about mental health aspects of our students, please realize staying quarantined or doing virtual learning from home is worse than going to school with a mask on. So please think.
Allison O'Brien, you may now make a public comment. Please unmute yourself and state your first and last name, as well as your full address.
Hi, my name is Allison O'Brien, 505 Andover Lane, Collegeville, 19426. I'm asking the board to please amend the health and safety plan and mandate masks for K-12 and at the very least K-6. I don't understand this 4-week masking period. Like Christina was saying, it just seems like an arbitrary time period that was just picked out. It's not like COVID's going to be gone at that point or Delta's going to be just disappear at that point. We all know that masking is an important part of a layered approach to keep our children safe and to lower transmissions and the amount of quarantines until a vaccine becomes available. Schools in other states are defying governor's orders because they know the importance and efficacy of masks. PA State Senator Katie Muth recently sent out a letter to superintendents in her district with mask optional plans, urging them to implement a mask mandate. She said, quote, "It is vital we have our children back in the classroom, and to do that, we must do everything we can to make classrooms safe. This is not the time to do what may be politically expedient or to leave the decision to individual parents and their preferences. Your decisions must prioritize the health and safety of all students and staff, and in turn, the health and safety of your district's larger community," end quote. And speaking of Senator Muth, I was shocked and appalled when I learned that Springford was the only school district out of 12 districts in the senator's area that did not attend a single COVID-19 meeting with her office. To me, that's just shameful, and I don't understand why when an offer is out there to get through this pandemic together, it was just ignored, and we were the only ones that ignored it. It's not one expert or one doctor. It's not one study or one investigation. It's not one organization or institution. It's the substantial and overwhelming scientific consensus that children in school should wear masks. You still have the chance to make this a successful year. Please don't let this chance slip away. Masks need to be mandated in school to make our children safer and to give our schools a chance to remain open. And again, I don't think it should just be this 4-week period. I think it should be at least a marking period, so then we can assess the data for at least for K through 6. But just this picking a date it just sounds ridiculous. Thank you.
Christine D, you may now make a public comment. Please unmute yourself and state your first and last name, as well as your full address.
Hi, Chrissy Jambowski, 310 4th Avenue, Montclair. I had stuff prepared, but I just want to say thank you to the board and to the administration for putting together a plan and revisiting this after last week's board meeting. I really appreciate it as a parent wanting to send their child in person for in-person learning. I just wanted to say, if the thought behind the new plan is based on looking at local numbers and hyper-locally looking at where we're at for risk transmission, we do know, based on other parts of the country, that it is going to get worse before it gets better, and there will be increased cases in our community. So we will have positive students and staff in our schools. So, we can't, you all as a board and what you decide, you can't control what happens in the community and in private homes and what people are doing and the choices that they're making, but you can enforce policies to control how safe our schools are. And universal masks are the best way, as we saw last year, to limit that transmission that's happening in schools, and also, as you discussed at length, limiting quarantines. I would just ask if you would maybe adjust the plan to have K to 6 masks required until those children under 12 are eligible for vaccination, since we really do not have a time when that's going to happen. And it's, sometimes it's fall, sometimes it's winter. So just keeping that in place for mandated mask K to 6 until those are eligible for vaccination. And then the tiered approach with 7th to 12th grades, since they are eligible at this time. So thank you very much.
Lauren Day, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Hi, this is Lauren Day, 57 Greenbrier Drive in Phoenixville. I'm commenting on agenda item 2A. I'm requesting that the board amend the health and safety plan to require universal masking for all staff and students in K to 12. Montgomery County is currently in high transmission category as it came out today. We know that masks work. We operated successfully last year with little to no in-school transmission. If masks are optional, we'll have mask quarantines and closures. Staffing will be an issue, and substitutes are already saying they're not willing to substitute in buildings that are not requiring masks. Even if you do not believe in math or science, we all have the same goal. Our goal is to keep kids in school in person safely. The only way to do that is to require universal masking. School is a place that we send to keep our kids safe. We trust the teachers, the administrators, and other families to do the right thing. There's a group of parents that are advocating for no testing, sending sick kids to school and not quarantining so all students can have natural infection. Their reasoning is to get everyone sick so we can get over this. This is terrifying as a parent. It's obviously that we have lost the trust of other parents. We are depending on the board, teachers, and administration to keep our kids safe. I beg that you require universal masking in K to 12. If you cannot do that, please do it in K to 6, at least until vaccines are available. Our children's lives are literally in your hands. Please make the right choice. mandate masks until vaccinations are available for K to 6. Thank you.
Kate Doyle, you may now make a public comment. Please unmute yourself and state your first and last name as well as your full address.
Catherine Doyle, 310 Woodland Drive, Collegeville.
Excuse me for a minute. Excuse me, stop the timer for a minute. We're not going to do this in the room. We won't do it. Go ahead, Mrs. Doyle.
Speaking on
If
agenda
there's
item
another
2A.
comment, I'm going to have to ask Officer Boyer, Chief Boyer, to intervene. So please, let's just not do that, folks.
Speaking on agenda item 2A, tonight there was another revision to the health and safety plan 6 days before the start of the school year. A new plan that has more safety precautions than the original plan that was approved in June is now on the table. Will there be metrics written into the plan that must be met before the board can reduce prevention strategies? I hope so, because the safety plan approved on June 22nd stated that masks would be required for all K through 6 staff and students until vaccinations are approved, students have had an opportunity to be fully vaccinated, and/or health recommendations change to support unmasking for all students regardless of vaccination status. Neither of those criteria were met last week, and while districts across the county were revising their plans to increase mitigation strategies due to the rising transmission rates, 5 members of this board voted to decrease risk prevention strategies for the most vulnerable students who are not eligible for vaccines or monoclonal antibody therapy, with no explanation other than passing the buck to the state or the Board of Health or county. The 5 of you made this decision knowing that without a mask requirement, there would be an increased risk of in-school transmission and the number of close contacts would dramatically increase, requiring more children to quarantine. Even if you do reverse your decision and approve this proposed plan, how will parents, students, and staff trust you won't reverse your decision again with no basis on transmission levels, vaccine availability, treatment options, or input from health and medical professionals? I would also like to see any changes made to the requirements be provided with at least 2 full school days to ensure ample time for parents to make decisions on how they wish to proceed and for teachers and staff to implement any necessary modifications to the building or classrooms. The primary objective of the administration and board should be a safe, consistent, and sustainable in-person education for our children. At this time, the best way to achieve that is through a mask requirement and additional mitigation strategies like outdoor lunches, additional HEPA air purifiers in the cafeteria, and utilizing additional spaces to reduce the risk of transmission while they're unmasked and eating. My 6th grade daughter asked that I include this sentence from her. I ask that you do what is right, not just for the parent trying to send their kid back to school safely, but for the child wishing with all their might that they can. Thank you.
Aparna Tola, you may now make a public comment. Please unmute yourself, then state your first and last name as well as your full address.
Aparna Tula, 49 Goldfinch Circle in Phoenixville, Pennsylvania, regarding agenda item 2A. I just want to say if this plan was put together as a compromise and to make sure that students do not quarantine in large numbers, and let me pose this for you to think about, right? An unmasked child with a parental waiver on file is infected with COVID and comes within 6 feet of my masked child. Then my child has to quarantine, and my child will not have any virtual education offered to them during this quarantine period. Is that right? I mean, think about that for a minute before you pass on this. I ask that you mandate masks for everyone so that's universal masking indoors for the first 6 weeks at minimum or for the first marking period. Keep it simple. We reevaluate and go from there depending on how the transmission looks like. And also another thing, substantial is not low. Substantial is not to be taken light, right? Just because last year's moderate is now broken down into moderate and substantial doesn't mean that we consider that these levels are just a play on words. There is a reason why it was broken down that way. It simply means that the moderate was too broad and that we as a community need to stay on alert when you reach that second part of what was considered moderate then. Anyway, when the transmission level is substantial, that's not a sign that we go through business as usual and wait for high to hit before we make mask mandatory. So I just ask that you keep that universal mask for indoor for everyone.
at least for the first marking period. Thank you.
Shayla Quasi, you may now make a public comment. Please unmute yourself and state your first and last name, as well as your full address.
Hi, my name is Shyla Quasi, and my address is 60 Page Lane in Phoenixville, Pennsylvania. I want to thank the board again for the presentation. I think it's very important that we consider everyone's opinions here. I just want to speak from a unique standpoint. I'm a physician in the emergency department, and I have two young kids, 5 and 7. My youngest is going to start kindergarten at Oaks Elementary this year. I'm 5. Okay, shh. You're not on. You're not on. Take a break. There's no cure for this disease. I'm seeing lots of kids in the emergency department who are coming in now with COVID after traveling to southern states, kids with complications due to long COVID. Mommy's talking. To think of COVID just in a vacuum in the fall is probably not the best idea. In the fall, there are a number of other communicable diseases that also occur, and hand hygiene, cohorting, masking, all of these things prevent many other respiratory illnesses as well. And, to say that you're going to just not get COVID or just only get COVID doesn't mean that you may not get one or multiple diseases at the same time. We know that many kids have been out of school for a long time, and they're going to be probably much more susceptible in the fall to many other respiratory pathogens. So I think the most prudent thing to protect everyone is to look ahead, think to the future, and know that communicable diseases are going to be something that's part of our agenda in perpetuity, and something that we have to teach our kids about. Wearing a mask is certainly not very difficult when considering the potential benefits for diseases that don't have any cure or treatment. Thanks again for the opportunity.
Vikash, you may now make a public comment. Please unmute yourself and state your first and last name, as well as your full address.
Hello, everyone. Good evening. My name is Vikash Agarwal. I live at 500 Dean Drive, Phoenixville, PA 19460. I would like to first take the opportunity and thank Dr. Rizzo to put such an amazing presentation together and bring out some valuable points that we have seen that we need to think through is the details on how we are planning to do all that stuff that needs to be done when we are going to make mask mandatory versus not. So I would recommend, my point is also in respect to 2A that we should be making mask mandatory. There is a saying that with great power comes great responsibility. I understand that there are health officials up the food chain who haven't made the mask mandatory, which we are strongly looking at. But that doesn't mean that we have to follow their steps and fall in the same pitfall. We have seen the neighborhood school districts which have already recommended and made masks mandatory. I will not quote on the number of school districts or anything like that, but we have seen the details so far. Hence, I would request the board to make the right decision and make the mask mandatory until vaccines are available for all kids. It was mentioned that survey was a part of the puzzle. Looking at all the pieces of the puzzle and the factors like the public comments and the recommendations that are coming from the administrative staff, from the nursing department, everything that we as a public or as a parent who are trying to understand what is preventing the board from making the decision of making masks non-mandatory or as a recommended. Again, it's our kids and everybody who would get affected. We do not have an option to go virtual this year. We only have the option of either, and we do not have any details. So if at all the kids get infected, we do not have any backup plan with respect to that. And we are increasing the risk by not making masks mandatory. One more point that I would like to make is when we drive cars, right, there is a probability of getting into accidents. I know people were or people in the board were asking about why we have not received any recommendations from the board, why, or from the Department of Health officials and things like that. Why are we kind of going towards making it mandatory? What I would like to quote is that when we drive on the road, we do put seat belts. We understand there is a probability of getting hit, and that's why in order to make us safer or feel safer, we do wear seat belts, and we recommend everybody sitting in the car to wear seat belts, despite all the hue and cry that we have to do in order to. That is how masks are. If it is going to make us feel safer and secure, and also reducing the risk, why shouldn't?
Mary, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Hi, my name is Mary McDougall. I'm at 7 Westminster Court in Collegeville. Last week, I was impressed by your ability to look at facts and to stand up for what is right, rather than to be bullied into doing something that makes no sense. Please do not go back on your stance. This new plan sounds to me like 2 weeks to stop the spread, and we all know how that went. There is no data to support mask wearing and no data that mask wearing is safe. Are you, as a school board, able to provide masks for the students that have been tested both short-term and long-term for safe wearing up to 8 hours a day, 5 days a week? Are each of you willing to be held personally liable for whatever adverse effects come from forcing Springford children to wear a mask? K through 6 are the last ones who should be masked, and your plan masks them the most. Mandating masks because of quarantine rules is political. Forcing my children to wear a medical device, not for safety, but rather for politics, is sickening. You are proposing to mask children for reasons that have nothing to do with health. That is absurd. We know children are not severely affected by COVID itself. You've seen the numbers. But they are affected by all these restrictions putting on them. They are affected by having to cover their faces all day. I'm tired of hearing about cases. Why does this matter? Are children dying? No. They have been playing sports. They have been traveling, hanging out with friends all summer long, and they have been maskless. And not one Springford child has died from this. When did we stop being able to get sick? Continue looking at reality as you were able to do just last week and let kids be kids. I was in a private school last year that did not have universal masking, and we were in school successively all year. These kids need social interaction. They need to see facial expressions, especially on their teachers. They have to learn social cues. They need fresh air. They do not need to be breathing in whatever fibers those masks are made out of. They have to stop being told to be scared, and they deserve to live their lives like normal children. And if a parent wants to put a mask on their child, they can do just that with your recommendation. No one is preventing them. They can put 50 on them. That's their right. You aren't taking that away. But please stop taking away my rights. Don't take away my choice to do what is best for my children. Take a stand like you did last week after looking at the data. Stop the irrational fear that is destroying our children. This will never end if everyone keeps complying to what you know isn't logical. If you truly care about the children and not playing politics, you will not change the recommendation. It is time to end the madness before it's too late.
Rohit Goswami, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address. I apologize. It looks like we lost Rohit. Michael Krantz, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
My name is Michael Krantz, 233 Winterberry Lane, Collegeville, PA, 19426. I'm speaking on agenda item 2A. Last week, I heard many parents give their views on making masks optional or required. The board voted to not make mask wearing required. For K through 6 grades, this decision overrode the majority of elementary school parents that wanted masks required for K through 6, about 63%. A day or so later, after parents were notified of this decision, the school district sent out an email entitled Reopening Toolkit. Included in this email was a section called, "When am I a close contact at school?" This section clearly illustrates that someone not wearing a mask in school who turns out to be COVID positive can have a negative effect on a person who was wearing a mask but was within 3 to 6 feet of the unmasked infected person. This graphic shows that a person who is following the CDC recommendations can be prevented from going to school due to quarantine rules because of the decision of someone to not wear a mask. This is not fair to that person and that person's family who are following the recommendations. These rules clearly illustrate how important mask wearing is for everyone inside the school buildings. So not only did the board go against the wishes of the parents, it also went against the overall goal of keeping people safe and being able to consistently attend school in person. I urge the board to not approve the amendment to the district's health and safety plan. A staff member or student who doesn't wear a mask in school is now making a decision that can affect someone else who was following the CDC recommendation of wearing a mask indoors. As an alternative, the board should consider a recommendation put forth by Superintendent Rizzo. That approach seems reasonable and is supported by key stakeholders, the teachers and the nursing staff. If the board decides to approve this change anyway, then I highly recommend that the district keep track of the number of students and staff that become COVID positive who were masked versus unmasked. Also, keep track of the number of students and staff that become designated close contacts and whether those people were designated as such due to an infected person deciding to wear a mask or not. That way, when this issue inevitably comes up again in a future board meeting, you will see what effect your decision has had on the students and staff of the district. Thank you.
Rohit Goswami, you may now make a public comment. Please unmute yourself and state your first and last name as well as your full address.
Hi, this is Rohit Goswami, 58 Hunt Club Drive, Collegeville, Pennsylvania. First of all, I want to point out someone who just now spoke, the lady prior to this one, the last one. Can I recommend folks who are attending in person not to cheer and clap? There is a huge difference there. People sitting in front of board of directors and people actually offline. Please do not try to create any pressure. Maintain silence in the meeting, maintain decorum. No one needs cheers on this topic, please. I want to start off with thanking Mr. Rizzo at this point for bringing forward an option that safeguard our kids. It's a very welcome option he has proposed. Thank you, Mr. Rizzo. I also want to start off with a response that I got back on one of my emails from last week. I got a note saying, please stay involved, and I encourage all community members to vote in November. I just want to highlight to board, and I just want to highlight to all audience, we are all on same side. It's not about voting one way or another. It's about safety of our kids, safety of our children. We immediately need to reverse the last week agenda items due to following reasons. And those are the facts also being stated in my email. Kindergarten to 6th grade students survey, parent survey was ignored as part of that decision. That survey came out to be 63% opting for vote for masking mandate. That was ignored, number one. Number two, not sure if nurse recommendation or our medical staff recommendations were factored in. If that was not done, please go back and revisit that. Thank you for bringing in Nurse Trish this evening. Number third, vaccination within kindergarten to 6th grade students is not available yet. We need to keep it consistent with how it was done last year. My kids are in same situation as last year. Nothing has changed, minus virtual option has been taken away. So we need to keep it consistent. Lastly, I'm going to repeat one of the pointer from my email, Delta virus is still in very early phases, and we do not at this point have enough data to support which way, one way or another. Keep plans consistent.
Emily, you may now make a public comment. Please unmute yourself and state your first and last name as well as your full address.
Hello, this is Emily Lucier. I live at 7 Long Meadow Road in Royersford, Pennsylvania. Thank you for having me speak this evening. So I would like to thank the board for making an amendment and like to speak on that for the health and safety plan. But I'd also like to request that amendment be extended for the students in K through 6. My point being that those individuals are not yet vaccinated, and with the Delta virus, there is still so much unknown. And I'd really like to urge the board to consider that we need to take as many precautions as we can for our individuals, for our most youngest and vulnerable. And with universal masking, we'll have as many precautions as we can with the distancing, the hand washing, and then the masking. And one thing that is really important is keeping students in school. So if we can have that universal masking through until when as many students who wish to get vaccinated can, then that would make a huge dent into the vulnerabilities that present themselves for that population. I'd also like to say that with limited precautions, the fewer there are, then you pose those risks of losing families, ours included. There are charter schools now that many families are looking into, and the more families that turn away from the district, the harder that becomes upon the district. So just consider that when you're evaluating the plans. You know, you really have to consider that you need to take these precautions because families will opt against sending their children into school. They will find ulterior places to put their children. And if that means pulling them from the district, we will. Thank you.
Joseph Salazzo, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Joseph Salazzo, 44 Woodley Drive, Royersford, Pennsylvania. I'll start off by thanking Mr. Rizzo, the administration, nursing staff, faculty for the proposal they put up tonight. It gets us closer to compromise. I was at the board meeting last week, talked a lot about trying to find that middle ground between all of us that want the best for our kids, which was to have them in school. What I'd like to see is that if we're going to change the plan that was approved last week, become more equitable in the distribution of the rules as currently presented. I'm trying to pick up the slide, the picture of the slide I took a picture of, but I'm struggling to understand why K through 6 needs a medical waiver while 7 through 12 needs just a parental waiver if we're not in high. I agree, if we're in high, that means things are really bad. We should take every precaution that we have available to us to protect the students and keep everyone in school. One of the earlier parents spoke about the vaccination rates of the 7th grade and 8th grade at about 22%, not much higher than their rate of 0 for K through 6. Yet their parents get the ability to make the decision that's in the best interest that they feel of their children in sending them to school. So if the board could amend or look at that, becoming a little more standardized. I know we've talked a lot about confusion, the different ways that the plan breaks down depending upon the building that you're in, the time of year. If you can get everyone with a parental waiver, as long as it's not high, I think that kind of bridges the gap the most, where we can have all the parties get at least some of what we want. And that is what compromise is all about. Thank you.
Sean Day, you may now make a public comment. Please unmute yourself and state your first and last name, as well as your full address.
Hi, good evening. My name is Sean Day, and my family and I live at 57 Greenbrier Drive, Phoenixville, Pennsylvania. I'm commenting on agenda item number 2A. Etiquette is a customary code of polite behavior in society or among members of a particular group. Common forms of etiquette we all are familiar with here in Springford are things like holding the door for someone behind you. Many of you probably did this coming into the meeting tonight if given the opportunity. If you didn't hold the door for someone, then the person behind you probably thought you were rude. Saying please and thank you, that's another common form of etiquette. Something we all have been taught as soon as we could speak words, and we teach the same to our children. And if you or your kids did not say please and thank you, someone thought you or your kids were rude. These forms of etiquette show how we treat each other and how much we value and respect others.
I'm sorry to interrupt, but I don't think that anyone in this room can hear what's being said. So maybe we take that person off, go to the next caller, revisit that person as the next time. Because I don't want to cut them off, but I couldn't hear what was being said.
Liz Kepner, you may now make a public comment. Please unmute yourself and state your first and last name, as well as your full address.
Liz Kepner, 19 Leatherwood Drive. I'm speaking on agenda item 2A. Everyone has their own opinion on masks, and I'm not here to change yours. I'm here to ask you to re-vote to keep our kids in school, specifically our K-6 students who cannot be vaccinated. According to the district's health and safety plan, it is obvious that the only way to do this is by requiring masks. I really hope the close contact chart will be shared tonight. It clearly depicts that if my child decides to wear a mask, they will need to quarantine along with half of the classroom if an infected classmate is not wearing a mask. If all students are wearing a mask, then the rest of the classroom continues to stay in school and learn. The only way to keep kids in school is by requiring masks, not recommending them. Recommending means optional, and optional doesn't protect all Springford students. I'm sure you've noticed that Montgomery County school boards have overwhelmingly voted to require masks for at least K-6, most of them K-12. Our own Springford parent survey shows that 63% want masks required for K-6. Why administer a survey if you don't care about the results? You said the survey was a piece of the puzzle. All other agencies are recommending requiring masks. What piece of the puzzle tells you to not require masks other than a personal opinion? Your new plan seems like you are trying to pull a fast one and keep us quiet for a month and then put us on a roller coaster for an endless amount of time. And a parent waiver form is just another way of saying masks optional. Let's put aside our personal beliefs in masks and come together to protect all children and require masks to keep them learning in school, not quarantining at home.
Michael Krashnick, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
My name is Michael Kranick, 71 Plymouth Drive, Royersford, PA, 19468. Basically, I believe that if your goal is to keep students in the school and to keep them learning, then it's a simple decision. They should wear masks, because otherwise you're going to have mass quarantines like you see in southern states that are mask optional, and it's just going to create confusion, and you have no virtual. So there's no help with that. And also, the stress it puts on them, but also the stress it puts on parents that now have to quarantine with their kids for that period of time, because kids in K-6 can't stay home alone. So that requires then a parent to stay home with them. So it just seems very short-sighted to not require masks when, if the goal is to keep them in school, masks are what can do it. So please change and require masks. Thank you.
Anne Marie Holstein, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Hi, good evening. My name is Anne Marie Holstein. I live at 221 Amanda Lane, Phoenixville, PA, 19460. I want to thank you for the ability to speak tonight, and I want to draw your attention to a study that was recently released by the Journal of the American Medical Association. The JAMA article was released on August 16th, 2021, and shows, I'll give you the download of just the summary, that children are spreaders of COVID-19. What that means is that while many families who do not wish their children to be masked will tell you that children are mildly affected, which may be true, although up to 18% of new cases per day are now children, and 1.9% of those cases will be children who are hospitalized. What we also know is that these children with statistical significance come home, bring this infection home, and spread it to their family members. The concern here is multifaceted. It's not just that family members will also be impacted by COVID-19, which may in turn cause significant or serious illness within their families, but that there will be significant quarantine times. I know that Mr. Rizzo has mentioned that a 10-day quarantine might actually only be 5 for children, but what we have to remember is that these children don't live alone. They have other family members, and as other family members are exposed, these other family members will have to quarantine. And in fact, a child with multiple siblings, according to my understanding of the quarantine rules, could potentially be required to quarantine for up to 4 weeks. And the question is, what's the continuity plan for these children to be able to continue to learn? The goal of everyone speaking tonight is the health and welfare of the children of the district. We all want that. We all want our children to be able to learn. We know that learning in school is important. This has been shown. A simple measure to be able to do this is to ask children to wear masks. I am asking you tonight on agenda item 2A to please revisit and make mandatory masking. Optional masking will not get us where we need to be. It will not prevent the spread among children and families. Thank you.
Nicole Basquill, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Hi, Nicole Basquill, 227 Egypt Road. I just want to say that I do appreciate the compromise that Mr. Rizzo put forth here, just the conversation that is happening. I looked at the plan and my first thought was, wow, that is admirable, but I think really complicated. And I think the complication and the timeline that's given there might ultimately be ineffectual. I do still believe we need universal K through 12 masking until we're in low transmission status and or all our children are vaccinated. We see from schools in the South where we're headed if we do not have mandatory masking. We're seeing in the news massive infection rates, quarantines, shutdowns, children in the hospital. Children do get sick from COVID. Children do die from COVID. There's also long-term effects that we do not fully understand yet. We know that mental health for our children is paramount. And what impacts student mental health the most is isolation and disruption to routines, not wearing a mask. Moreover, not mandating masks is not protecting the health and well-being of staff and faculty. I haven't heard them mentioned that much tonight, but I know many are anxious and scared to return to the buildings without the most basic safety measure, which is masks, in place. Without healthy teachers working in a positive school environment where they feel truly cared for and listened to, I don't think you can have a good supportive school. Lastly, the language that we've seen before of recommend really has no teeth. There wouldn't have been cheers and clapping last week if the motion was really recommending masking. Recommend is code for optional. I'm all for choice, but when it comes to public health, optional just unfortunately doesn't cut it. You all have a moral imperative to rise above partisan politics and protect the well-being of students, staff, and faculty. The state and county have unfortunately left this in your hands due to complicated legal and political reasons. So you need to take their recommendations as they were truly intended and mandate masking until we are in low county transmission. Thank you.
Heather Staley, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Hi, Heather Staley, 412 New Street, Spring City, PA. I applaud you guys for trying to come up with a compromise, but the compromise has some flaws in it. You know, you have the fact that people are vaccinated and that's a magic shot. It is not. There are breakthrough cases. People can still spread it from that. What I'm trying to say is nothing's going to be 100%. Masking is not going to save everything. Vaccination is not going to save everything. And unfortunately, as someone who is on the front lines, this is not going to go away. We are going to have to learn to live with it, and it is going to ebb and flow, just like the flu, just like H1N1, just like people having RSV and other things. We also have to understand that at some point we have to make a choice. Last week, you guys made a choice, and then the calls and stuff came in, and now it's changed. What I don't understand as a parent is if you were working on this, why we made a decision at all last week. If we were working on something that had some other teeth to it, some other things, then to me, it almost feels like it was a false vote last week. I was happy with the vote for giving it back to the parents, because I do think the parents should have a choice. There are other things that we do to help our immunity and everything else. I do think that, you know, a lot of you, even the ones who wear masks, go out to restaurants and take it off. As Colleen said earlier, COVID, how does it know when we're eating or not? You know, we're okay when we're eating. I'm frustrated with the fact that I feel like it's back and forth. I wrote an email to the board, you all know that, about the fact that it's back and forth constantly. My 12-year-old last week was excited about maybe seeing friends' faces, and now I have to explain to her that she's not. And next week, you know, what's going to happen with the next board meeting, and then from there, and then from there, and all the changes. And when I spoke about mental health, that's what I'm talking about. We're confusing our children. We're not giving them a school thing. How can we expect them to lead or understand how things are going if we keep changing things? Yes, I understand. Delta's this week. Next week it's Zulu. Whatever. It's going to change. It's a virus. But we also have to find something that's comfortable to live with, that we can actually use and understand and not be so complex. I'll just give you a piece that, you know, even as someone who works on the front lines, the hospitals are no longer telling the people on the front lines when we're transporting patients who has COVID or not, because they can't contact trace. That's a piece that I don't think some of you understand. There's some of these things that I do have understanding about, that, you know, contact tracing went away 2 years ago, because you can't tell if you got it from Wawa or if you got it from here or if you got it from there. The problem is we don't know how you get.
We have about 15 more minutes of the comments on Zoom, then we'll hold any others that are left. They'll have to put their hand down and raise them again later during the second public comment section, but we do have 15 minutes.
Sharon Bittner, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address. Sharon Bittner, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address. Sarah Gillette, you may now make a public comment. Please unmute yourself and state your first and last name, as well as your full address.
Hi, my name is Sarah Gillette, I'm 78 Forest Court, Royersford, PA 19468. I'm asking the board to change the decision that you made last week regarding masks optional for the 2021-2022 school year. The COVID Delta variant is impacting our children more than the original strand was. It's causing hospitalizations, admittance to ICUs, and even the need for mechanical ventilation in children. I think it would be negligent of the Springford School District to bring our children back into a building that they know has unsafe conditions, where they can't keep our children safe. If you had knowledge of severe mold in the building, you wouldn't bring our children back. So why would it be any different when it comes to a potentially deadly virus for them? I mean, I know as adults, if we want to take a chance, that's okay, but these are children. So I don't want the chance to be with them. We don't know the long-term effects of COVID on our children. I just don't want to take a chance when the best way to protect them is masking and then vaccines once they become available. I'd ask that we talk tonight about the cafeteria situation, because even if we mandate masks, if Springford can't maintain even a 3-foot minimum between unmasked children in the cafeteria, then the masks probably don't matter in the rest of the building. So, I would ask, if you would want to eat in a cafeteria with hundreds of other unvaccinated, unmasked people sitting, 1.5, 2 feet from each other. If not, then I wouldn't want to force our children to tolerate those conditions either, because I really do think that they're unsafe. I think the goal of every parent is to keep our children safe and allow them to continue their education within the district. Doesn't benefit anybody if families are forced to enroll their children in charter schools as a result of Springford's negligence to keep them safe. The PDE advised that it costs the district roughly $8,000 per child for each child who leaves the district. This doesn't even factor in the costs to the district to re-enroll children as necessary. Parents could opt for charter now and then re-enroll and then opt back out and then re-enroll, and all of those are additional costs and changes for the district and the teachers and all of that. Why would Springford choose to incur those additional costs instead of putting together a plan that allows all children a safe, synchronous learning environment? If the Springford district knows this is not safe, it would be negligent to bring the children back under the current plan. So I would just ask if we could please mandate masking and come up with a better plan for the cafeteria, because even if it saves one child's life, isn't it worth it? Thank you.
Sean Smith, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Hello, my name is Sean Smith. I live at 19 Marshwood Drive, Collegeville, Pennsylvania. First, I'd like to thank the board for the opportunity to comment on this issue. I appreciate the board has a difficult task ahead of them, and a lot of people will be upset no matter how the decision turns out. I'd also like to thank Mr. Rizzo for presenting a compromise that takes into account the amount of community spread and we can adapt to that. I don't think it's overly confusing, and I do appreciate the fact that children in grades K through 6 have a mask mandate. One last comment I'd like to say is masking isn't a personal decision. The ability to not mask your child impacts other people in the community. So sometimes doing the right thing isn't the easy thing to do. We have a reality. We're facing a communicative disease passed by respiratory droplets. Put a mask on, prevent spread. Thank you.
Allison Johnson, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Hi, my name is Allison Johnson, 79 Ashley Drive, Schwenksville, Pennsylvania, 19473. I'm a new parent to the Springford School District with a 5-year-old son about to enter kindergarten. We have a 6-month-old daughter. Our reality is that both of our children are especially vulnerable to COVID-19, given they are both unvaccinated. Our son has been preparing for kindergarten all summer long. We've had so many conversations. We talk about his new teacher. We talk about meeting new friends, taking the bus, reading chapter books, learning to write. We talk about the importance of kindness, of sharing, of respect. What we don't really talk about is masking. And that's because he's never whined a day in his little life about wearing them. He knows he has to wear them right now to keep him safe. He knows that wearing a mask allows him to play and learn and do all the little things that a 5-year-old wants to do and should be doing. It's really that simple. I ask you tonight to amend the health and safety plan by making masks required for all teachers, staff, and children K to 12. Why K to 12? This is a no-brainer. In addition to the Delta variant, these children do not have the advantage of layered mitigation. They are missing a key layer, and that is vaccination. Making masks required in addition to distancing and cleaning measures gives these children the best chance at staying healthy while staying in school. 6 to 12, in addition to low vaccination rates of this age group in our county, the reality of the Delta variant is that even if vaccinated, breakthrough infections are happening. This population should wear masks to protect those that have not yet had the opportunity to get vaccinated, like my children and so many other children who will walk through your halls. Please remember, this age group have siblings that have not been vaccinated yet. While I appreciate that you attempted a compromise, I'm disappointed with the recommendation presented tonight. Bottom line, it makes me nervous. It's confusing, it's highly caveated, and quite frankly, it creates the yo-yo effect that you stated you wanted to avoid. One day you require masking and the next day you don't. That's a failed policy right out of the gate. Just require masking until further notice, period. Children need consistency, parents need consistency. This plan seems more focused on appeasing a fringe group with a lopsided goal of reducing the number of healthy children being quarantined, as opposed to keeping them from contracting the virus to begin with. The survey didn't even make these confusing caveats. It was simple, require it or don't, period. If this confusing plan is approved, I will leave tonight with no real predictable way to make sure my child is safe through the school year, and with the clear conclusion that my child will not be safe in a school that can't make up their mind about keeping children safe first and foremost. Let me
Kavitha K, you may now make a public comment. Please unmute yourself and state your first and last name as well as your full address.
Kavita Krishnamachari, 46 Starmont Way, Collegeville, Pennsylvania. The mood painting last Monday has been nothing short of disappointing. Having said that, I want to thank Mr. Rizzo for his new recommendation. Masks have proven to save lives in the past, and given the recent developments of Montgomery County's community spread being high, it is all the more necessary to mandate masks from K to 12 indoors for the safety of all. Universal masking is a must, and it's the only way to keep the spread of this virus, which is still relatively new, under check. I'm failing to understand the debate over this, while so many of our neighboring school districts have mandated masks for all grades. The recent Delta variant has been deadly in the way it spreads, and I'm sure everyone is privy to the damage it continues to cause. This is not the time to relax norms and let our guard down after enforcing them for such a long time. After close to 18 months of asynchronous and virtual learning, my son, who is a second grader now, was finally looking forward to go in person. And it broke my heart after seeing the board vote against mandating masks. I'm not sure how I'm supposed to explain this to him, that he might not be in a position to attend in-person school if this mask mandate is not in place. While I can supplement him academically, there is nothing I can do to ensure that his social needs are met. Nothing can replace the benefits of in-person learning. And while most of the parents have clearly indicated their choice of mandating masks for safety through the survey, I fail to understand the struggle in implementing it. I today urge the board to provide an acceptable solution that will keep my son and kids like him safe in an in-school environment, taking cognizance of the fact that this age group is not eligible for vaccinations yet. I still have faith in human nature, and I hope the board will consider mandating masks for K through 12. Thank you.
Suni Lee, you may now make a public comment. Please unmute yourself and state your first and last name as well as your full address.
Hi, Suni Lee, 2 Brentford Court, Collegeville, PA 19426. I'm calling about action item 2A. I want to first say we all want our children in school, and we as parents can all agree that being in school is what's best for all of our kids. So if that means mask up to remain in school, then let's mask up. I implore you to rethink, revote on your vote last week, making it mask optional, particularly for our kindergarten to 6th graders. Let me remind you all that you voted for mask mandate for kindergarten to 6th in June. You knew the parent survey prior to coming into the meeting, and still yet you chose mask optional for our young children who don't even have the option to get vaccinated. Just to be clear, our children under the age of 12 do not have the option to be vaccinated as of today. There are many pieces to this puzzle, like you said: parent survey, nurses report, substantial to high transmission rate, vaccination option, and now even the administrator's report. I agree you all shouldn't have to make this decision, but here's the thing, you do have to. So let's stand together to have all of our kids back in school and vote mask mandate, especially for our kindergarten to 6th graders. And similar to some of the other callers, please vote consistently by voting mask mandate for at least the first quarter, or when all kids have the ability to get vaccinated. Thank you.
KS, you may now make a public comment. Please unmute yourself and state your first and last name as well as your full address. KS, you may now make a public comment. Please unmute yourself and state your first and last name as well as your full address.
Hi, my name is Kelly Sherrar. I'm at 23 Ashford Way in Schwenksville. Everyone seems to be so focused on masks or no masks. My biggest concern actually through all of this is the kids that are in quarantine who have no live teacher instruction. My son was in 5th grade last year and had to quarantined twice, the K through 6 kids cannot get vaccinated, which means there will be many quarantining again this school year. It's crazy to think that these elementary age kids can teach themselves the lessons on Canvas. Last year, I sent many emails to the principal and to the teachers, and the teachers emailed me back and said, quote, "We feel very strongly about our kids and don't want them to be on their own." They went ahead and opened up their Zoom rooms for my son, which was absolutely amazing. Other kids did not have this opportunity and were at home learning on their own. So my question is, what is the plan for this school year with regards to kids in quarantine and no live instructions? My hope is that, and I'm asking please to open the Zoom rooms for these kids, to make it easier on the teachers, let them teach and keep the kids on mute. Let the kids just listen to the lessons. They can save questions for later during office hours. Please, please consider this. Thank you.
Before we go any further here, we're finishing up at this point. Are there any remaining people? Okay, those 4 are going to have to put their hands down to the later public comment. And also the person that whose voice was muffled, did that person speak? Or is that person still in that crowd? Can we just hear from him before we move on? Because he was up already.
Sean Day, you may now make a public comment. Please unmute yourself, then state your first and last name, as well as your full address.
Can you hear me?
Yes.
I think you can hear me. All right. Thank you for letting me have my time back. And I'll ask my wife to mute her camera as well. All right. Etiquette is a customary code of polite behavior in society or among members of a particular group. Common forms of etiquette we're all familiar with here in Spring-Ford are things like holding the door behind you or for someone behind you. Many of you probably did this coming into the meeting tonight if given the opportunity. And if you did not do it, the person behind you thought you were rude. Saying please and thank you is another form of etiquette, something we've all been taught to do since we could speak. We do it for we do the same thing for our children. And if you or your kids do not say please or thank you, someone thinks that you or your kids are rude. These forms of etiquette show how we treat each other and how we value and respect others. There are other forms of etiquette that go beyond just being nice and courteous of others. Things like washing your hands after using the bathroom, or coughing or sneezing into a tissue or your elbow are common forms of etiquette. Doing these things are not only nice and courteous to others, but they actually help prevent illness by not spreading our germs onto others. Nobody's advocating that we break those traditional norms of preventing germ spread by not blowing our nose or coughing or sneezing into our elbows. But with this all said, if it's so ingrained in our society that we wash our hands after we use the bathroom, or we sneeze or cough into a tissue or our elbow, why are we debating the use of masks in our schools? COVID is spread from just breathing and talking. So our etiquette has to adjust beyond washing hands and coughing, sneezing into a tissue or elbow. The Delta variant makes wearing a mask a form of etiquette. Wearing a mask is polite behavior. Wearing a mask shows that you value the students, teachers, and staff. If you send your kids to school without a mask, you're frankly being rude, and you should keep your rude kids away from my kids. Thank you.
Okay, we're going to wrap up the comments on Zoom at that point, and we're going to go in person now. As I said, as a reminder, when you come up to the mic, announce your name and your address, talk for your 3 minutes, then take the clipboard and move aside, put your information down so the next person behind you can start while you're recording that information. Mr. Olson.
Thanks. Roland Olson, 711 Sourwood Lane. For starters, I just want to ask, does anybody have any questions about what's going on tonight in the plan?
I do. Can you pull that mic up so we can all hear you?
Yeah, sure.
Thank you.
So I guess I'm not alone in having a few questions. There should be no vote tonight. I mean, thousands of students and parents are going to wake up tomorrow to a significant surprise. This presentation should have been part of the agenda materials that were posted online. I don't, if you thought you were getting emails last week, you're going to get a lot more this upcoming week if you hold a vote. You know, why were we not allowed to view this beforehand. Further, we have no opportunity to ask Mr. Rizzo or the board any questions related to this. So how is this even a subject of debate? I don't have the whole thing memorized. I mean, this is the first time I've seen it. I don't know if you guys have seen it already, but quarantines were mentioned, were updated. The vaccine was included in the plan. When the thresholds have changed. People have questions. It doesn't matter whether you're wearing a mask or not wearing a mask. This should not be a voted on agenda item tonight. That's for starters. Second is, for those people who are asking, hey, why aren't you listening to the survey results? Have you been around for the last 15 months? There hasn't been one survey that they've listened to, okay? So let's get that out of the way. I'm an open book as it relates to data, and I'm an intense researcher. I don't care what anybody says. I want the core data. So if masks are going to work, somebody show me the CDC data showing that masks work. Mr. Rizzo just got up here and said there's no efficacy proven that masks work. So why are we wearing them? Okay, as soon as the CDC, hey, keep it down. As soon as the CDC comes out with data that says mask wearing is going to protect our kids from COVID-19, yeah, include it in the plan. But don't use your feelings to say that that's scientific data. None exists, zero. But I will stand around, I'll stand over there, and anybody who has the scientific data that proves that masks work, you come find me. I will look at the data that you show me. And that goes for board members, because I've sat here for 15 months. I wanted to watch the Little League World Series tonight, but I couldn't because I was worried what was going to happen. That one item on the agenda, I didn't know what it was. Frankly, I'm sorry I showed up. I've stood here for the last hour so I could be first. Would it be fair to say at this point, given Mr. Rizzo just said that there's no proven data for masks to be effective, that we've just argued about something for 2 hours that there's no effectiveness? He just said it in his presentation. Did nobody hear it?
Okay, I'm sorry, Mr. Olson, I do have to interrupt you briefly, please.
Did you restart the 259?
Stop
Because I'm
it,
happy to
no,
start.
no,
No,
no, I'm
listen,
not
I'll
gonna
take
restart the
time
whole
out in a
thing.
minute. I'm happy to
But
talk for a couple more
please,
minutes.
and this goes just for everybody, when you're coming up, please make comments to the board, right? We're not gonna rally the audience, we're gonna make comments to the board. And I also ask, you can hold your posters up during your turn to speak, but not behind every speaker that comes up to that podium. So that's the way it is. So if you're in line, then you get in line, otherwise, please take a seat.
Got it. So Mary McDougall, Heather Staley, I probably aren't doing you justice, but
Ms.
the reality
Zazowski,
of it is,
his time
you
had
guys did a
concluded.
great job. My time wasn't up.
It was up.
Sorry. You guys go. Next victims.
Rebecca Daniels, 1211 Meadowview Lane, Montclair. Quarantine if one is unmasked or unvaccinated. Please hear me loud. I would like to give another spin to this whole health and safety mess, Action 2A. Doesn't US main media report these days that the hospitals are running out of bed due to the Delta variant among the unvaccinated? But does it tell CDC's definition of unvaccinated? If anyone is vaccinated on June 1st and then gets the second shot 6 weeks later, will still be considered unvaccinated until 2 weeks after the second shot, which is August 1st. So if that person gets sick anytime between June 1st and August 1st due to the Delta variant, of course, the unvaccinated are blamed for the spread. WHO European Advisory Group of Experts in Immunization, former Vice President Professor Christian Perron last week said that all vaccinated people must quarantine over the winter month or risk serious illness, confirming the rapidly deteriorating situation in Israel and the UK. This infectious disease expert stated, vaccinated people should be put in quarantine and should be isolated from the society. He went on to say, unvaccinated people are not dangerous. Vaccinated people are dangerous for others. It's proven in Israel now. I'm in contact with many physicians in Israel. They are having big problems. Severe cases in the hospitals are among vaccinated people, and in UK also. Per another doctor in Israel, Kovi Habib on Channel 13 News said, the effectiveness of vaccine is declining and disappearing. In fact, 95% of, that means almost 100%, seriously ill patients are vaccinated. I'm sorry for all this scary news, but the good news is that before a booster shot, which will be definitely pushed very soon.
Are you speaking to an agenda item?
2A, yes.
What is specific to 2A? I mean, this is not an issue. No, you're not talking about masks.
Okay, so you're taking my time. So can I get my time if I answer you?
Focus your comment on the action
This
item.
is about masks. That's because of COVID and quarantine, all related. One still has time to verify this information on a site such as thehighwire.com. Thank you.
Michael Lebajinsky, 2005 Willowwood Drive, Royersford. Last Monday, 6 members of this board voted their commitment to align to the recommendations of the CDC, Department of Health, and the Office of Public Health. If any of these agencies in their expert medical and scientific opinion and based on the data believed masks should be mandated, they would have mandated them as they have done in the past, period, end of story. Let's call a spade a spade. The approach on quarantine is just an end run to bait you into wanting your kids in school and therefore requiring the mask. When I read tonight's agenda, it clearly says the Board of School Directors. It does not say the Board of Health Directors. The Springford administration, with all due respect, has educational backgrounds, not relevant legal or scientific expertise. This is clear in the recommendation, which is exactly the opposite of what the data says. The younger children are, the lower they are at risk. That's the CDC data. It's linear. They're younger, they're low risk, younger. If you change your vote from 7 days ago, why? What facts have changed in the last week? Are you responding to the mob who suffer from this mass psychosis? All of the clinically significant symptoms are visibly present. Let me give you just one example, quoting board member Wright from last Monday night, quote, "I don't even care if masks actually work or not, as long as they make families feel safe." When someone is willing to ignore whether or not masks work or not, when voting on policies that are literally based on whether masks work or not, that's an indication of mass psychosis, politics, or both. In a great school district that Springford is, there's no place for either. Hospitalizations and deaths, not cases, are the historical and appropriate measure of risk during a pandemic. We know the PCR test is inaccurate. That is exactly why the FDA has announced they're revoking the PCR's emergency use authorization at the end of the year. How can you base a mask policy on a test that is going to be revoked due to inaccurate results? Do you even know when the last death occurred in Montgomery County? How many deaths occurred in Montgomery County in the last 2 months? The age of the people who died? Think about that for a minute. If you cannot answer those questions, you do not understand the data well enough upon which to base your vote. If you do vote for any policy that mandates masks, you are voting to place a medical device on our students. You are stating that the reason for doing this is to reduce COVID infection. By the FDA legal definition, that constitutes a medical device. And according to the FDA, that requires informed consent, which requires you to provide a written understanding of the risks and benefits and offer reasonable alternatives. And this consent cannot be under coercion. You're wading into very dangerous legal territory, which I'm sure Mr. Fitzgerald has advised you. By mandating masks in excess of what the CDC, OPH, and DOH recommend, are you willing to accept the liability for these actions? Ultimately, health and science are at issue here, not education, not emotion, and not feelings. Most schools in Europe are not masking. You tell me masks work here but not there? And Hawaii, you want to see the data? Look at the data. 98% mask, and their hospitalizations are up 854%.
Hey, good evening. Charles Battle, 2606 Noble Way. This is my first meeting. I thought it was more interactive. I'm not afraid of my kids getting COVID. I'm afraid of them being taught that white people hate them and are oppressing them. So I wanted to make sure we're not doing critical race theory in the district.
Okay, that is not an agenda item.
And I can send an email. I just didn't understand.
Sir, that's not an agenda item.
Because this public comment is specifically on agenda items.
Okay.
So that comment, which you're free to talk about that, would be later in the meeting, in the second public comment, correct, Mr. Fitzgerald?
That would be a non-agenda item.
And I find it ironic that we're all sharing a pen. When we're all supposed to be
Sir,
COVID.
okay.
That may be appropriate.
Good evening. Kenneth Kalisek, 213 Cherokee Circle, Royersford, Pennsylvania. I see you leaning in. It's because I have a mask on. It's okay. And not everyone is using the same pen. Some of us do follow the CDC guidelines. Mr. Rizzo hit the nail right on the head at the beginning of his presentation. This is about our kids, their health, and keeping them in school. My kids both homeschooled last year, the entire year, and did cyber. They were both very excited to be coming back this year, but only if we can do so safely. If we go with a plan that doesn't require mandatory masking, we're going to end up with these quarantine periods again. I have friends last year whose kids were quarantined multiple times, disrupting their lives, disrupting their kids' lives, disrupting their education, disrupting this teaching, having to come back after being quarantined for 4 or 5 days, and trying to get back in place with what you missed. Unfortunately, being able to do things just on Canvas doesn't work. The kids need to have live instruction. I thank God last year that the school offered that for my kids through the cyber program. Additionally, COVID's going to happen. I'm not sure if everyone here is aware, there was already one COVID incident this school year at the cheer camp that happened on August 8th and 9th, the Spring Forward cheer camp. At that camp, one cheerleader, unmasked, contracted COVID and showed symptoms the second day of the cheerleading camp, that evening after it was over. When that was over, multiple children, kindergartners, first graders, all had to quarantine or be tested. My daughter had to go be tested. I stood there and watched as she uncomfortably shoved that needle up her nose, the swab, and cried about it. That's what we're subjecting our children to if we don't go with a masking policy. We're allowing other people to make choices for our children. Because when you send your kid to school without a mask, you're making the decision for me who sends my kid to school with a mask.
Sir, please.
Additionally, under the same policy that I was sent by the school this week, we're going to have to quarantine every kid that comes into contact with someone who's positive if that person doesn't have a mask on. How many kids per class is that going to be? How many kids is that who's going to be quarantined? Whether they're positive or not, they're still going to have to be quarantined and they're going to miss school. And as Mr. Rizzo said, that's what we don't want. Thank you very much. Stop kids dying then.
Where are they?
Okay, we're moving on. We're moving on.
Hello. Tony Patrick, 410 Laurel Lane Oaks. Sorry, I just want to apologize first for I did not really mean for you to die at my last, approach here. And today I'm sticking to a script. So with the Dr. Mercola is take control of your health here. There's why masks are charades. The stories at a glance driving the irrational and unscientific narrative about mask wearing is the censoring of truthful and factual information by tech platforms. YouTube recently banned a video by Senator Rand Paul, who is a medical doctor, in which he stated that masks don't work. In 2020 email obtained via Freedom Information Act, Dr. Fauci stated the typical mask you buy in the drugstore is not really effective in keeping out virus, which is small enough to pass through that material. February, the UK authorities published guidance discouraging the use of masks even for healthcare workers in residential care facilities, as there's no evidence that they prevent viral spread. Randomized controlled trials have long been regarded as the gold standard in medical research, yet RCTs are now ignored when it comes to mask wearing. Of the 14 RCTs that have been tested, the effectiveness of masks in preventing the transmission of respiratory viruses, 11 suggest masks are either useless or counterproductive. The remaining 3 suggest masks may be useful, but not to a substantially significant degree. So I went further back in his his notes. Hand washing beats mask and mask plus hand washing combo. So the study founded by the CDC added hand washing to the mix to see if mask wearing would work better in combination with hand hygiene. One group was instructed on the use of hand hygiene only, a second group used both hand washing and face masks, and a third group did not. While the mask plus hand washing group fared statistically better than the control group on one measure, the hand washing only group beat the control group to a statistically significant degree in two measures. This suggests hand washing alone was actually the most effective measure, according to the authors. So no additional benefit was observed when face mask use was added to hand hygiene by comparison and hand hygiene alone. The notion that hand washing alone beats even the combination of hand washing and mask wearing gained support in a 2011 study which discovered that among those who washed their hands and wore face masks, the secondary attack rate of influenza-like illness was double that the control group, which did nothing. So multivariate analysis showed the same thing, leading the authors to conclude that relative to the control group, the odds of infection among those wearing masks and washing their hands
Okay,
was
thank you.
twofold
We're
in
at
the
3
opposite
minutes.
direction from the hypothesized.
Gary Wheaton, 31 Beach Court, Collegeville, PA 19426. Sent the board a very detailed email today. I'd like to change the discussion here. The masks don't work. My third grader got COVID last year. Brought it home to me. They don't work. Unless you come up with a mask standard, if you're going to put them in place, it's got to be an N95, a KN95, or they have new zinc masks that are very effective. So a lot of the masks that the folks are wearing in this room, they're not effective. Okay? It's like throwing marbles at a chain link fence. Okay? So the Delta variant's here, the Gamma's in Brazil, the Beta's in South Africa. They predict in 2022 that they're going to come together and this thing's going to get worse. If you want kids to wear masks, they have to have a standard. Look at the CDC data. We are 18 months in this thing. The state, the local, and the federal government can't get their you-know-what together. It's insulting. Choose masks that have 2 or more layers of washable, breathable fabric. Completely cover your nose and mouth, fit snugly against your side of your face so you don't have any gaps. Have a nose wire. How many kids have masks that have nose wires? I bet you it's probably a very small percentage. They do recommend N95 to be prioritized for healthcare workers. That's why I'm suggesting you look at alternatives. You have to have a mask standard. And then they tell you how to wear them. Kids aren't going to wash their hands before they put them on. How to store them. When they're dirty, put them in a plastic bag. Kids don't put them in plastic bags when they wear them, especially K through 6. If they're not dirty, put them in a paper bag. Do we still have paper bags at home? I'm not sure if I have any paper bags. There's a lot of research out there that says that the N95 and KN95 is preferable. So I'm saying that if you guys make kids wear masks, I'm not debating that right now because there's enough, dissension amongst that, you're going to give kids a false sense of security. That's the bottom line. And by the way, congratulations, Dr. Rizzo. I belated on your promotion. I declare your office today. So I reached out to Joe Cerisi's office today. I'm waiting to hear back from him. I'm sure we can find some funding somewhere in the $6 trillion whatever budget we're gonna send through the federal government. We're getting funds somewhere. So let's figure it out. Otherwise, it's a false sense of security. It's cosmetic and it does not work. Thank you.
Hi, Ed Krasinski, 100 Osprey Way, Phoenixville, Pennsylvania. I said last week that the CDC does not follow its own biosafety guidelines. It clearly says in their own biosafety manual that masks don't work. We've had enough people here who have said that, okay? They do provide a false sense of security. There's really no data that shows they do work, but there's plenty of data that shows that they don't. And if you go to the COVID tracking project, as I said last week, 1.8% across the entire 50 states, people who get infected with COVID die. However, if you look at it state by state, The states that had the most critical lockdown measures and mask mandates, Michigan, 2.3%, New York, 2.5%, Pennsylvania, 2.7%, New Jersey, 2.9%, all had higher death rates than the national average. You look at Florida and Texas, where, oh my God, we have all these cases. Their percentage of death was only 1.7 in Florida and only 1.64 in Texas. So that masks aren't doing anything, okay? A comparison outside of the United States, if we look at Sweden, which is the only country in the world that just said, the heck with it, we're not doing anything, we're gonna carry on, we're gonna have it. Their death percentage through the whole COVID was 1.6, and it's now in Delta down to 1.3 because they have established a herd immunity by having people out there, by having people get exposed to this thing, okay? We have an irrational fear of this COVID. Seasonal flu killed 500 school-aged children in 2018 to 2019 in the United States. That's more than COVID has killed since we've known about COVID. But I don't see the school board going to mandate masks during flu season. Seasonal flu is never going to go away. It's always going to be here. When kids get flu, they stay home. When parents get flu, they stay home. We need to do the same things with COVID, and if the quarantine measures are not in sync, we need to address those. We need to look at those a little bit more and maybe fix those. The last thing I would like to say about all these irrational fears is that, you know, we treat this thing like it's the monster under the bed, like it's the boogeyman in the closet. And for those that are that scared of it, stay home. You don't have to come out. But school board, please let those who want to get on with life return to a normal life. Thank you.
I always got to follow a tall guy. Justin Baird, 67 Knifer Road in Limerick. You can really tell the wheels are coming off when an introverted software developer actually comes out to one of these. Yeah, I'm good. All right, so.
Okay, nobody's going to call out from either side. Nobody's going to call out from either side, or we will end public comment. Okay, then I will address that, but we're not going to have that coming from the audience, or we'll end public comment here.
All right. So I'm not going to stand here and read you statistics because everyone knows that 78.59% of statistics are made up on the spot. I've watched nearly every school board meeting since the pandemic started, and I acknowledge you guys have gone through a lot of grief for the position that you guys volunteered for, including have a protest outside of one of your houses, which is ridiculous in my opinion. I think the level-headed among us realize that you did not volunteer for heading the school during a pandemic, but here we are. You've been entrusted with the job of providing all of our children a safe place to learn and grow into productive members of society. Now, keep in mind that the governor is not directly responsible for the safety of our kids in Springford. The Department of Health is not directly responsible for the safety of our kids in Springford. You 9 are. You're our local government body. So I realize that this is a really incredibly complex problem with a lot of opinions on pretty much every side. And it's very intimidating being up here. I don't know how you guys do it. But luckily, this can kind of be boiled down to one very simple, logical question. And we all know how much we love simple questions here. So the question is, do you believe that masks are effective to any degree at all in stopping the spread of COVID within the school? No other information, statistics, personal beliefs, or arguments, even those presented by an incredibly handsome, bald guy like myself, really matter. If you believe that wearing a mask provides any increased protection at all, then you should require them to be worn in school to protect our children to the safest possible degree. Please, I beg you to do the job that you promised to do when you're elected and protect our kids. Thank you.
Thank you. Come on, you can come up.
Hi, oh, can you hear me fine? Okay, hi. My name is Sana Manala, and I am going to be a senior this year at Springford, so I'm one of the students whose future you guys are deciding right now. A little about me is I actually have underlying health conditions, So I was a virtual student all last year, and Ms. Ritter said something really important in the beginning of this meeting about how important it is for students to be in school for social, emotional, and academic learning. I've been here at Springford since I was 6, from kindergarten at Oaks. I love school. I love coming in, and some people have the choice to wear a mask and have the choice to wear a mask, but some people don't have a choice. I want the choice to come to school. I want to come to school. I want to be a student. I want to see people. I want to have connections with my teachers. I want to learn. And unfortunately, if you guys don't make masks mandatory, there is no virtual option for me. I'm not willing to risk my education and go take cyber school at Springford. I don't want to do that. Furthermore, vaccination is also not a requirement for all students. The least you guys can do is ask students, for the sake of students like me and other people, to just put a cloth on your face. It doesn't hurt anybody more than getting sick with and ending up in a hospital. You guys are responsible for the safety of not just some students, but for all students. And it's true, and I'm not saying that wearing a mask is not difficult for people. I'm sure it is, but sometimes doing the difficult thing is the right thing, because you guys are accountable for all of us, not just some of us. And you guys won't be attending schools. Parents, you guys won't be in the crowded hallways. I will. Other students will. So I genuinely just hope that you guys make masking mandatory for the sake of students. And the other thing I wanted to say, I have a minute remaining, but I was sitting in the back, and I'm actually appalled at some of the behavior of the parents here. You guys are here talking about the safety of us, but when a doctor on Zoom says that children are ending up in an ED, you snicker about it. Why are people like that having a decision about my safety? I'm here to speak up for myself. I've not been out that much. I was not even in school. I came to return my books, but I'm here to speak up because that's how important this is for me. So I really hope you consider that. Thank you.
Hi, my name is Arshad Amanullah. I'm Sana's dad. Thank you for the opportunity to speak here. This is my first meeting that I've attended, and I come here really for my daughter and other students who are in the same boat as her. I have 2 older children, my wife and I, who are alums of the Springford School District. All 3 of my kids started off at Oaks Elementary. One's now in med school, the other one's in college, and Sana's the last one to go through here. And I have to tell you something. You know, myself and all parents, you know, when we are bringing up our kids, every morning, we walk our kids to the school bus, and we entrust their safety to total strangers. Right? Think about that. We all do this. From the moment they leave home to the time they come back, we're trusting total strangers that our kids are going to be well educated, this is a tremendous school district. And the other, more important than that, we entrust their safety to you guys, right? To all the staff. And what I want to say is of all the issues that you all debate and all the important decisions you make, the 2 most important, the obvious ones, have to do with the education and the safety of our kids. And this debate is not about politics. It's not about mask, no mask, this or that. It's really about keeping all of our kids safe, right? We can't afford one single student getting sick and ending up in the hospital or something worse, right? I professionally, infectious disease and vaccines are my life's work. I'm responsible, if you've taken the flu vaccine, I'm probably responsible for the development and approval of those. I'm going to tell you something. The data I saw up there, if you're using community transmission, what's happening in the local area as the benchmark, we may be headed for some trouble. You got to be looking at transmission within a school environment. You have children at close quarters, a perfect breeding ground for the virus, and anything we can do to keep them safe, even if it's a mask that prevents transmission to some degree, we need to keep in mind. One last comment. I know my time is up.
Well, we're at 3 minutes, sir.
Okay, thank you.
Hi, everyone. My name's Karen Weingarten at 6 Dorothy Circle in Royersford. So I wanted to talk a little bit about why we're hung up on the recommendation, the word recommendation instead of require. When I'm looking at this list of all of the schools, all the school districts in Montgomery County, as well as a couple surrounding OJR and Phoenixville, I just want to let you know where everybody stands on this, and I think some of you may already do. K through 12 requires masking at OJR, Phoenixville, Abington, Boyertown, Colonial, Hatboro, Horsham, Jenkintown, Lower Marion, Methacton, Norristown, Perk Valley, Pottstown, Springfield, Upper Dublin, Upper Marion, Upper Moreland, and supposedly Wissahickon will be switching from K through 6 required to K through 12 required within the next day. K through 6 required, Lower Moreland, North Penn, and like I said, at the moment, Wissahickon. The only schools in Montgomery County translating recommended as optional are Pottsgrove, Solderton, Springford, and Upper Perk. That's it. The majority of those school districts were able to translate the CDC, the American Academy of Pediatric recommendations, into a requirement, making sure those students are safe. And that's what I'm not understanding why we are hung up on the recommendation. Last week we were told, hey, reach out to the county, reach out to the state, reach out to the government, anyone you can to see what they can do. And guess what they said? Well, everybody else is able to figure this out. Your boards should be able to do it. So everyone else was able to figure this out except for 4 districts in all of Montgomery County and the surrounding areas. I'm telling you, it's right here. They all have it down. Pottsgrove, Solderton, Springford, and Upper Perk are the only ones that don't have a mask requirement. And I appreciate everything that was presented today, and I think that is moving in the right direction. But compared to everything else in Montgomery County, I don't think it's good enough. Thank you.
Hello, my name is Brian Jagasak. I live at 1808 Prince Court in Royersford. I'm here today to express my utter disbelief, disgust, and disappointment in the final decision that was made by the school board on 8/16. It's a sad state of affairs when my local hair salon has the intelligence, courage, and moral aptitude to adopt a required mask policy in the light of CDC and Montgomery County recommendations, but my children's school board does not. I was comforted at the start of the summer knowing that the school board had made the right call in anticipation for the forthcoming school year, and that I was even interested, in my opinion, by way of a mask policy survey. Yet remarkably, the course of action was reversed in order to pander to a minority of K-6 parents with the loudest voices, independent of the 62% of parents who had expressed that they would want mask requirements for K-6 to keep their unvaccinated children safe indoors. Further, personally, I struggle to understand how the present decision helps support parents of children with special needs like my children. We have a legally binding IEP that states that our children should be afforded the opportunity to participate in a normal classroom setting 80% of the time. For my children who have high-functioning autism, in-person social interaction is critical to their overall success. I felt good at the start of the summer understanding my boys would not have to navigate the potential socially challenging situation of masked versus unmasked children, as every child would have the same expectations and requirements. That has now been taken away by the decision you have made. It is unfair to expect me or any other family in similar situations to have to enroll our children in a cyber classroom environment contra to what their IEP and their best interest. Also, as school board members, the polite way to cough is into your arm, not into your hand.
I'm short, so. Hi, my name is Maria Cagliola, and I'm at 148 Oak Creek Drive in Royersford, Pennsylvania. If you can't hear me, please let me know. First of all, I want to say I'm speaking on item 2A, and second of all, I will say in advance that it's a good compromise, Dr. Rizzo, right? So I think it's a great start. The one thing I do want to say is I won't go into all the data, the science, and the stories of countless schools that did not mandate the mask and are quarantining and closing. Instead, I come here tonight looking for compromise, a very reasonable request around mandating masks for K through 6. Similar to last year when I and several parents came to you asking for a hybrid with the same intention, to bring our children back to school safely and together. I truly feel, as so many of the other parents do, that we shared what was right for our families within that survey. Over 60% of our parents advocated for masks for their children in grades K through 6. I ask you to think about the impact of not listening to those parents. Now, at this moment, and when you need future insights, they will be jaded and unsure if their voice matters. That is exactly how I feel and so many other parents feel at this moment. Sorry. I ask you to make sure tonight that those voices are heard and consider the downstream impacts to not adjusting the decision. They include forcing parents out of the district into charter schools as they try to find other educational programs that will protect their children. This essentially negatively impacts our taxes going forward and means less money for our schools and for our services for our families. Forcing parents to be separated from other Springford families. Our villages are critical, but offering minimal options such as hybrid or mandating masks essentially handcuffs our parents and separates them from the families they have been staying safe with when they need their villages most. Causing parents to now challenge everything on both sides. Freedom from masks on one side, freedom from mouth guards or dress code. Where does it end? Causing, again, like the other first two, further division. But most importantly, it puts the little ones at risk, like my daughter. We know some families in the district don't believe in COVID. They think it's caused by the 5G, as we heard last week. This means they are not taking precautions. And make no mistake, they will bring those germs to our school and share them with their friends, which is essentially why we will be bringing back quarantines and closing, which no parent wants. Like I said in the beginning, I consider myself a person of compromise. We must compromise in our life, and this is no different. This is not a one-size-fits-all. Allowing masks to be optional for the kids in the over 12 population, I could understand. But for the under 12, this is where compromise, health, and empathy for this age group needs to be exercised and correct to mandate masks for, at a minimum, K through 6.
Okay, thank you. Fit 3 minutes.
Thank you.
Stacy Salazzo, 44 Woodley Drive, Royersford. I don't deny the difficulties anyone here is struggling with regarding the decisions you have to make. But absent any significant changes in guidance from the CDC, state, and our local level, this school board is putting an item on the agenda again within a week's time to reopen discussions. Just last week, you deliberated, voted, and approved said item. You should allow the community to process and adjust prior to the start of a new school year, not this constant back and forth that creates so much stress and anxiety within our community. We struggled with the board and administration for over a year deliberating about a plan, and here we are now, where you just approved the health and safety plan last week and are now bringing it back yet again for another round of discussions. Now it appears we are making the same mistake again. Nothing has changed to warrant this. The CDC hasn't changed their guidance. The Department of Health hasn't changed their guidance. And the Montgomery County Office of Public Health also has not changed their guidance. The only thing that has changed is a week's worth of feedback from the community. You need to base your decisions on logic, data, and facts, not feelings. But some, based on last week's comments, that, unquote, I'm not so concerned if masks are effective or not. What my concern is how my students and their families feel about that. And if they feel that they are safer and willing to come in, then that's what's important. What about those parents that know based on 3 marking periods of feedback from their children that a mask disrupts their learning? Do they no longer have a voice? What about those that have come home and said that they aren't getting mask breaks and it's hard to breathe during the day when they're wearing masks 6 hours every day? Per the parents' survey, almost 40% of those parents are now losing their choice if you make any changes that are going to mandate a mask. You are now pitting parents against each other, those that don't want masks and those that do. You are causing unrest for parents and students. This inability to make a decision and stick with it is hurting the school community. This wavering is now making students scared. We have all been out and about all summer without masks, seeing friends, socializing, going on vacations, participating and attending sporting events. But now, with school starting next week, you want to make more changes and put into place an illogical mandate that even the state and county isn't willing to do. You're putting a fear into students and parents that kids are going to come to school and get sick. The only reason we could possibly be talking about this again tonight is due to board members requesting a change yet again. Just last week at Montgomery County Board meeting on August 19th, Val Arkush opened the meeting with a COVID update, which included slides showing the number of cases. On that slide was the incidence rate for the previous weeks of July 30th to August 5th and then August 6th to the 12th. It was 55.7 per 100,000 and 68.2 per 100,000. If you then look at the CDC chart, that would fall into substantial. But then if you go back to our slide and look at the column to the immediate right was a positivity rate, which was 4.2 and 4.3. Go back to the CDC chart. That's under 5%.
Okay, we're at 3 minutes. Thank you.
Hello, Valdemar Starushchak, 136 Larchwood Court, Collegeville. We as a community need to decide who are we protecting by asking or mandating our kids to wear a mask. Are we trying to protect all of the adults here who have an option to get a vaccine? You believe it or not, that should be your choice. Are we trying to protect kids from the virus that poses as close to a zero risk as possible to get? We are also many times here heard that parents saying that we should mandate K-6 mask wearing because they're not eligible for vaccine. Those kids most likely do not need those vaccines to begin with. That virus, no matter what study or statistic you look at, those kids are not at risk from this virus at all, period. So they don't need to wear that mask because they are not at risk to get sick seriously or die. Most of the kids, we have some kids who died from COVID, that was listed as one of the reasons from COVID deaths. Most of those kids, they had serious underlying conditions. So, somebody before me mentioned the country of Sweden. My sister lives there for many years. She said that not a single business was closed, not a single school was closed for a day. Nobody, never, ever in any place mandated a mask. People who were sick stayed home. Kids who were sick stayed home. And yet, with those no restrictions in place, their COVID numbers are much better than United States. And just to remind you, Sweden is the country that has the same quality of life as us and the same healthcare index as United States. So we can compare us to that country as well. Their COVID numbers with zero restrictions are better than ours. So mask, shutdowns, restrictions, at least the ones that we have here, they didn't work and don't make a difference. Maybe if they even make it things worse. My daughter lost entire year of school because 1 week she was waking up every night having nightmares and been afraid that COVID will come in at night and will kill us all, will kill our grandparents, my parents, her sister. We pulled her from school. She did learning remotely, not the best option. So I please ask you, stick to your guns and keep the last week vote in place. Don't change anything. Recommendation is a recommendation. For those who do not know English well enough, recommending a mask and making it optional are two different statements. If you recommend it, you are going along with all the experts. You are doing exactly what the experts on all the levels, federal, state, county, all of them agreed on. Recommend mask. And that's exactly what you want to do. People who are saying those are the same thing as optional,
okay, thank you.
no.
3 minutes.
It's a different thing. Thank you.
Doug Sigafus, 212 Walnut Street, Spring City, PA. Remember the movie Dead Poet Society? All the students had to stand up on Robin Williams' desk to get a different perspective, to look around the classroom. Everyone here on both sides of this issue needs to do this, to understand where everyone is coming from and to see the world from a different point of view. My reason for being here tonight and speaking tonight is simple. I love my children, I love my neighbors, I love my community, and I love my country. Now let's put the odds of dying from COVID into perspective. You have a 1 in 92 chance of dying from an opioid overdose, or odds. The odds of dying in a motor vehicle crash are 1 in 107. The odds of dying from being struck by lightning is a 1 in 138,849. The odds of dying from COVID for children is 1 in 500,000. The odds of children ages 5 to 14, K through 6, is 1 in 2.4 million. So, my suggestion for the health and safety plan is to throw it out. Masks optional. If you're sick, stay home, wash your hands. I think we should address obesity, since that's a big issue. That's the larger issue in this country. It leads to heart disease. Obesity since 1998 has doubled in children and adults, from 20% now for kids and 40% for adults. With that, I think we should double kids' recesses. I think we should increase physical activity.
You're off, I'm sorry, but you're kind of off topic.
Okay. Well, it's along the health and safety data plan,
We're talking about the mask.
which is included in the health and safety data plan, or health and safety plan.
Specifically, the item that's on the agenda.
Roger that. Last week, you followed the guidelines from the CDC and the Montgomery County Board of Health, specifically that states recommend universal masking. According to the Disease Prevention and Control Law of 1955, Section 3A and B, the responsibility of disease prevention and control is specifically stated as under the Secretary of Health, local Board of Health, or Department of Health, including disease control in public and private schools. As you are aware, there is no state of emergency, there is no mask mandate by the Board of Health, and you have no legal authority to mandate them, as specified in the aforementioned law. Only the local Board of Health does, and that is actually for a very limited amount of time. I'm going to read you a tweet from Thomas Sowell. It's hard to imagine a more stupid or more dangerous way of making decisions than putting those decisions in the hands of people who pay no price for being wrong. As a parent, the health and safety of my child and my children is my responsibility and my responsibility alone. I'm the one who makes the decisions for them, not you. We as parents have evaluated the risk and have the right and authority to make the decision for our children. We have the most to lose as parents if we are wrong. That is why it is our responsibility. I'm not challenging your authority, I'm denying it completely. Thomas Jefferson said, when tyranny becomes law, rebellion becomes duty. Thank you. Have a good night.
John Yonchuk, 12 Edmonds Drive, Royersford, PA. I want to start tonight by thanking Mr. Rizzo for his very clear
Excuse
presentation.
me, please put the posters down when it's not your turn. Thank you. Go ahead.
Yeah, I want to thank Mr. Rizzo for his very clear presentation. It's a shame that the board did not allow him to present clearly last week and rather asked him to verbally update on our survey. For 18 months, many members of our community have acted responsibly during this pandemic. We erred on the side of caution because this is a novel virus. We stayed home, we masked up, we got the vaccine as soon as we could. We did this because experts who dedicate their entire life's work to it told us this was the way to get our lives back. When we learned that outdoor activities were relatively safe, we supported that. When we learned that universal masking as a behavior reduces transmission, we supported indoor activities with universal masking. When we learned that vaccines eliminate almost all of the worst outcomes, we went out and got the shot. That's what rational people do. I too am tired of the authorities privatizing every decision in this pandemic, but it has still not stopped me from making the right choice. I find it comical that Mr. DeBello spent 5 minutes questioning Mr. Fitzgerald about mandates, considering last year he openly and eagerly urged citizens to violate the governor's order when restaurants were closed. I'm tired of having to spend money on medical grade masks and taking them everywhere and wearing them, but I still do it. I do it because it may save a life around me. I do it because it may save someone from months or years of long COVID. and because at worst it's a minor convenience. I got the shot, and so will my son as soon as he's eligible for it. Tired or not, all of you have a duty to protect all of our children, even if others around you won't. That is your job. You have a legal duty under Pennsylvania law to provide an appropriate education in a manner that protects all children's health and safety. If you are tired and you don't like that anymore, I keep hearing that you have a choice to resign.
We're not calling out from the audience. Thank you. Go ahead.
Teresa Westwood, 70 Plymouth Drive, Royersford, PA. First, thank you for the opportunity to speak this evening. I'd like to speak to Agenda Item 2A. I want to say thank you to Mr. Rizzo and for the board for preparing a revised health and safety plan for all of us to react to. I appreciated you listening to some of the comments from some of the parents last week, so thank you for that. I come in front of you again this week to ask you to require masks for K through 12 students and staff, and at a minimum K through 6 students and staff. Many of our neighboring districts, as we've already said, are requiring this, including Phoenixville, Norristown, PV, Methacton, and ONJ Roberts. As was shared in the parent survey last week, over 60% of parents want required masking for K through 6. By requiring masks and other prevention strategies until such a time when case counts drop and/or a vaccine becomes available for younger school-age children, we can maximize the chances that schools stay open and more students stay in school. We are all in this together, and I think many of us have a similar goal: to keep our children and staff safe and to keep our schools open. That said, I hope you'll reconsider your decision you made last week and vote for required masking, with the exception of legitimate reasons such as medical. Thank you.
Nick DiCarlo, 227 Canal Street, Phoenixville. Not going to get into any kind of studies or surveys or anything like that. That ship sailed. The study that I see is different than everybody else, and that's okay. I appreciate everybody's opinion. Thank you to the board members for hearing everybody's opinion. Really, I just want to share an email that my wife sent. She can't be here tonight, but she sent to the board earlier this week. We got some responses, which thank you for that. It was good to see. That's it. I just want to share that. My name is Corinne DiCarlo, and I'm the mother of a first grade student at Oaks Elementary. I'm also a registered nurse that has been seeing COVID patients since the beginning of the pandemic. Purpose of this email is to express my concern over the decision not to mandate masking for students and teachers. We have a student in first grade. Preface it with that. The majority, 60% of elementary school parents voted to require masks for K through 6, yet the school board still decided to only make the masking recommended instead of required. The school board should be speaking on behalf of the parents, students, and teachers. Quite honestly, I'm not even sure why you surveyed the parents if you're going to decide against their wishes anyway. I don't understand the logic. After reading about the decision, I had a discussion with the situation with one of my colleagues and professor of clinical medicine, Division of Infectious Diseases. She was so dumbfounded and confused by this decision that she took the time out of her busy day to draft the attached letter. We won't get into that. I ask you to review the letter and seriously consider her position. The letter is based on factual quantitative data, not opinions of parents who may or may not believe that the pandemic is real, or who claim that the act of wearing a simple cotton mask has caused their child mental or emotional distress. I ask that you reconsider the vote and reverse the decision in order to mandate mask wearing, at least during times of elevated transmission rates. Also, please ask yourself this question: how will you feel if the unthinkable happens to just one single child, and that child's COVID infection is contact traced back to a non-mask wearing student while in your school building? Would you feel as if you could have done more to protect that child from infection? I would hope so. If I were in your shoes, I would want to take every precaution to protect the health and well-being of Springford's students and teachers. Thank you.
Hi.
Go ahead, please state your name and address, and if you're
Christine Pisano.
talking about item on the agenda. Just pull that mic down towards you a little bit.
Sorry, Christine Pisano, 342 South Mennonite Road in Collegeville. So I didn't plan on speaking, so I'm kind of just going from the hip. I do have a lot of, things that I wrote down and important points, but some of them, can be summed up. A lot of other people already did say them. Everyone wants to say it's not political and it's not personal, but I feel like it's all I hear is someone's horror story or someone's upset or safety. People are yelling at people about killing kids and booing people. I mean, you want to say it's not political and it's not personal, and no offense. I understand that you didn't like the date thing earlier, but we had to sit here for 10 minutes and listen to how it made you feel. But it's not supposed to be political or personal. So it's I don't understand why we're just not sticking to facts and real things and can logically speak about them. I said no offense, I mean no ill will, but I'm just being honest. I came here to a school board meeting to talk about a mask mandate for my kid. Not worry about if you're upset about a date. I just didn't feel like it stayed on subject. A lot of this didn't stay on subject, but some of it did. There was one person that was unmasked that mentioned that there is zero standard for the mask that all of our kids and everyone's screaming about to wear. There is nothing that says a 2-for-5 Target cotton t-shirt shaped like a mask is gonna do anything beneficial for our kids. And who knows if in the long run, it won't be detrimental. I'm not saying COVID is not real. I'm not saying it's not serious. I'm not saying we shouldn't take health and precaution issues. But every person, masked and unmasked, came up here and put their hands all over this podium. They touched the mic. I only saw one of them disinfect their hands, and these are adults. Somebody took their mask off and laid it right on top. We're talking about adults, right here in a safety meeting. How do we expect kids to regularly change out their masks, to know where to put them, to know that if they get filled up with saliva, because my kid that's going into kindergarten is 5, do you think there's not going to be all kind of stuff in there and food and, why isn't anyone that's screaming about the safety of our kids worried about anything else than a cotton t-shirt? Nobody's worried about, hey, what about timely hand washing? Hey, what about everyone bring in child-safe wipes so that kids wipe down their own stuff? Hey, why don't we talk to everyone and put up signs everywhere? I mean, I don't know if you're doing this, but I'm just saying, everyone is yelling. I'm sure you are, but I'm just trying to make the point that everyone is arguing and being political and being personal, threatening to take their kids out of school and they're putting them somewhere else. And no one's worried about just general sanitation. A cotton t-shirt over your face could be detrimental. You don't know that, and it's not beneficial. We do know that. So I don't want my 5 and 7-year-old to wear them all day.
Okay, we'll have one more speaker, and then we have to cut it there at that point.
Hello, Mary Jo McNamara, 187 Abbey Drive, Royersford, Pennsylvania. Thank you, Mr. Rizzo, for listening to both sides, for trying to present something to have, some kind of a compromise. However, the data didn't present itself with your presentation tonight. The CDC, the state, the county, at your own words last week, can't really get their numbers together, can't really show their substantial, moderate, high stuff. I'm sure it will come in a couple of weeks. That's great. But for now, it's not there. So I'm going to give some numbers. The number 0, I'm going to say it again, the number 0 in Brook Elementary, in Evans Elementary, in Oaks Elementary, Limerick Elementary, Royersford Elementary, Upper Providence, 5, 6, 7, 8th grade center, 9th grade center, and the senior high school. The number 0, students admitted into the hospital. Students dying from this pandemic in our district. The number 0. If you look at the Montgomery County dashboard as of today, the number of patients hospitalized in the county is 96 adults. That's 96 in a population of 830,000, which comes out to 0.00012%. There is not a single pediatric ICU bed being used in Montgomery County right now, today. So there's some numbers. I'll also give you one additional number. 794 children ages 0 to 18 died from the flu in 2017 and 18. I know the veterinarian gave a number for 18, 19, I think, or 16, 17. So those are numbers. We're not talking about the flu. People get sick. I get sick, you get sick, stay home when we get sick. I know that it's a more significant disease, or illness. I know that it takes a few days to recover. I've had it in my family, in my immediate family. It's affected us. Everybody gets sick. I don't know why we're considering cases. You know, it's the antibodies and the herd immunities that work. In foreign countries, you can see that, right? Those numbers have been gone over. Masking is a feel-good measure. It was witnessed by Board Member Wright last week, and I'm going to quote, I think other people have, "I don't even care if masks actually work or not, as long as they make families feel safe." I don't want a representative like that voting for what my child gets to do. That's inappropriate. She should abstain from her voting right.
Okay, 3 minutes.
Oh no, I had a really good closing paragraph. Sure. Thank you, everybody.
Okay, so with that, thank you all for your public comment. We are going to move on to our action item. And then after the action item, we're going to take a 5-minute recess prior to resuming the rest of the meeting. I understand that there were people in line, but I also did say an hour on Zoom and an hour in person, and that the comments then could resume during the normal, not normal, but during the public comment at the end. So is there a motion for action item A, 2A, a motion to approve an amendment to the Springford Area School District's Health and Safety Plan consistent with the recommendations of the administration as presented this evening by Mr. Rizzo? Is there a motion?
I would like to make a motion to approve required masking from K to 6 for the first marking period. I would like to adjust it.
So I'm to understand that Mrs. Fazzini wants to amend the motion that's on the table.
There's no motion on the table.
I would like to make a motion.
Okay, so there's a motion that's been made by Ms. Fazzini in response to your request for a motion. So we'll have to see if there's a second to either of the motions.
Okay, is there a second for Mrs. Fazzini's motion? I second it. Okay, any questions or comments?
Let's just be clear then what this would be. As I understand it, you are seeking a mask required K through 6, which essentially goes back to the original health and safety plan. Is that my understanding?
That's correct.
Okay.
Does that include the tiered approach after that Mr. Rizzo presented earlier regarding Springford numbers?
I thought the tiered approach was actually part of the original plan also, but no, it wasn't?
No, so is your only change here, instead of going through September 24th, to go to through the first quarter? Or are you eliminating that other approach also, the tiered approach?
Yes.
Yes, can you?
What's yes?
This, with the tiered approach, K to 6 required first quarter.
So K to 6 required first quarter, but with the tiered approach. So your only change to the proposal would be the timing of September 24th to the first quarter, correct? And we have a second for that, so are there any other questions or comments?
Mr. Rizzo, I want to make sure you understand what the proposal is, just so you, and maybe we should restate it again. Just we were speaking in kind of lingo here. Let's make sure we understand what we're.
So my understanding is that we have made a motion to essentially do what I suggested, with the exception that we're going to the end of the first quarter instead of September 24th. With that first tier. Yeah.
Correct.
Okay.
Mr. Solicitor, would, based on the way the action item is written, and based on what we've heard from Nurse Smith via Mr. Rizzo and the teachers union, should that be amended? Because right now it just says administration.
Well, yeah, I mean, the action item would not be what is on paper. It would be what was brought forward by Ms. Fazzini, which was effectively the proposed plan with the one modification being an extension of the mandatory mask K through 6 through the end of the first marking period. So it would not necessarily be an official administrative recommendation. It would be a modified board motion that amends that recommendation. But I understand the motion, and it'll reflect accordingly on the minutes.
I just have one question. Is that, Mrs. Fazzini, is that kind of using the same qualifiers that were there previously, which was unless a vaccine were to be, or there was a significant change, or is it going to just be straight through the first marking period, just for clarification?
I think straight through the first marking period, and then we can revisit it at that point.
And Ms. Fazzini, that's just K to 6, correct?
Correct.
Okay.
You're giving me a look right now. I wanna make sure you're-
The plan was a K to 12 plan, not a K
Right,
to 6 plan.
again, her modification is specific K through 6 to be mandated through the end of the first marking period. Everything else, as I understand her motion, is consistent with the recommendation you brought forward tonight.
Well, that first phase is a K to 12 phase in the high.
Right.
Correct, and that would be unchanged.
Okay.
Yep.
Didn't want to change that.
Good, just thank.
So we're effectively changing the date of the motion is what we're doing. Instead of September 27th, we're saying the end of the first quarter.
For the
Or whatever the date is.
Yeah, that becomes
And that's what I'm hearing.
Yes.
What is the date that is the end of the first quarter?
Was it November? Something?
It's got to be somewhere around November.
Like 6th.
We don't take comments from the audience at this point. We don't take comments. We don't take comments from the audience. I'll just say it 5 times. We do not take comments from the audience at this point. We are sitting here deliberating on the motion that's on the table. I understand that the ballpark would be later October, early November. So, one more time, let's clarify it before we take a vote. Okay, so the motion would be for mandated K through 6 until the end of the first quarter. 7 to 12 would be recommended unless we go into the high range in Springford specifically. Is that correct?
Yeah, I mean, maybe I'm oversimplifying it. It's simply going to be everything we heard tonight it would be adopted, except the extension for K through 6 would not end on September 24th. It would continue on to the end of the marking period.
And Mr. Rizzo, can you get behind that as an administrator, as our superintendent?
Yeah, I mean, can we have a vote, please? I mean, we're just kicking this thing around. I mean, I believe we've had our presentation by our superintendent, and that's not what he presented. So by asking him if he could get behind it, to me, is misleading. We've already had his presentation.
We have, but at that time, that wasn't proposed as an option or discussed at that time. So if Mr. Rizzo can't support it, I'm not sure that I can. If Mr. Rizzo can support it, Is it something that you've even considered, Mr. Rizzo?
Okay, so to your question, can I support? I mean, I can support it. I don't know that it's necessary. The reason why I picked September 24th was so we can follow and track the data. So if you take it to the end of the quarter, then we can take it to the end of the quarter, which I believe is November 5th. I've got received a few texts. If you want to take it out that far, you can take it out that far. Again, for me, it was about monitoring the data and seeing where things go.
Yeah, I got a comment. I mean, it sounds like, 2 weeks to flatten the curve, and now we're a year and a half later. I mean, I really liked what Mr. Rizzo put forward. I was willing to get behind that because at least it's monitoring the data. We have plans and options in place. I was willing to do that. But now we're just arbitrarily saying, well, I don't agree with that date, so I want to go to the end of the quarter. So, I mean, again, I agree with Mr. Schaefer. I mean, Mr. Rizzo put forward a recommendation. He talked with the nurses. He did everything that we would ask, everything that was put on the table, everything. And then we're just throwing out an arbitrary date. I mean, he gave his reasoning. His reasoning was because he was told by the county that this Delta variant is going to spike. They believe it's going to go down. That's what he was, right, Mr. Rizzo? Correct me if I'm wrong?
You're correct.
So I could get, there's a lot of things I just don't agree with, but I'm not going to get into that right now. But I was willing to at least go and compromise and take that step forward and say, all right, I'm willing to go that far. Let's look at the data. Let's follow what's going on. Let's see if there's a variant drop and where we go from there. And if we have to, if it makes sense, or if the data doesn't support what we're thinking, it's automatically going to continue on anyway.
Well, I mean, I think I would love K-12 required, and I'm willing to compromise also. I feel as though it's not about the number of kids who are a mortality rate, which I hate to bring up, or how many kids are in the hospital. I feel that my main goal has always been to keep students in person in school 5 days a week. And I think our best success last year doing that was using layered mitigation, safety mitigation, and our biggest tool was masking. It's one of the most effective tools in layered mitigation. And to take that off the table, especially for K-6 who do transmit it, and then we're going to have quarantines and we're going to be out of school and we have these consequences that we have to deal with. Staffing might become an issue, quarantining kids might become an issue. We have lost learning, and those are the consequences that we have to take responsibility for. And I want those kids in school, and I think that this is a compromise to see how it goes. If after, I don't have any problem, we can revisit this. If we're keeping them successfully in school, we're winning the battle. If we're not, I mean, if 7 to 12 starts transmitting and they're unmasked and we see that we have issues, we're going to have to revisit that. That's just the way I think it is. If you look at the schools that have opened unmasked, they are having breakthrough to the vaccinated, and the unvaccinated there's transmission going on. And a lot of them are shut down and have gone to virtual, gone to hybrid, or have large number of quarantines. That's a fact.
All right, do we have any other comments on the motion as it stands? I do have one comment to say that in no way did I mean to put Mr. Rizzo in an awkward spot there, so I apologize for that. It was really coming from, I don't want to overlook the importance and the impact of administration in this, and that's what it was. Going forward, are there any more questions
yes.
or comments? Go ahead,
I mean,
Mr.
based on Ms. Fazzini's last statement, I'm confused where the motion is now, or what.
The motion hasn't changed. It's K-6 required masking.
As presented by Mr. Rizzo.
But till the first marking period is ended.
She changed the date. Oh. That's all she did. She just changed this date to the end of the market period arbitrarily. So I'm not supporting it.
Okay, are we ready to move forward with the vote, or are there further comments or questions? So all in favor?
I just one comment. Mr. DeBello, I hear you. It seems arbitrary. I get it. No more arbitrary than September 27th. It's a date. So let me finish. I deserve the respect as well. But I also do think that we have 63+% of our K-6 families have indicated that they prefer masking be mandatory. We need to hear that. We need to respond to that. Our nurses have indicated that it is safer, it is better for our students. It certainly will keep our children in school. Certainly our K-6 students did it last year. And of course, if there are significant changes to the numbers, whether it be within our footprint or otherwise, it's something that would be reevaluated. We will do that, I think, for anything. You know, if we start seeing that we have healthy students being quarantined at obscene numbers in our 7 through 12, we're going to have to take action, and we're going to have to evaluate that. But I don't think it's fair to our families to say, you know, 4 weeks and then we don't know. Then it's just going to be a Harry-Carry, figure it out. I just don't think that's fair.
Okay, any other questions or comments?
Can we take a vote?
All in favor, say aye.
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 All opposed?
No.
No. So we're going to have to do roll call to be sure? Or did we have enough? I'd like to take a roll call on this important matter to be sure. So, Mrs. Earl?
No.
Mrs. Sullivan?
It's my understanding that it makes it clear to those voting when it's stated that if you vote yes, this is what you're intending. If you're voting no, this is what you're intending for the outcome. I was just informed of this last week. Would that help out to make it very, very clear to everyone voting what your vote means?
I think we all understand. I think we all understand what
Tom,
the vote
don't
means.
laugh at me.
Okay,
I know you think
no
it's
one's gonna
funny,
laugh.
but
We're
that
not
is
laughing.
incredibly
But honestly, Mrs.
disrespectful.
Sullivan, that has been the way we do it from the beginning. So nothing has changed in respect to the way we vote. So yes, if you say yes, you are in agreement. If you say no, you are not. So at this point, I ask for you to cast your vote.
Yes.
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 Mr. DeBello?
No.
Mr. Jackson? Please use your mic.
No.
Mr. Schaefer, oh, I'm sorry, Dr. Wright.
Yes.
Mr. Schaefer?
No.
I'm a no.
So again? Again?
So, Mr. Fitzgerald?
That was just, that was an amendment to the original agenda item. So there has
Okay.
been no action on the original agenda item, which was
So
presented
is
this
there
evening.
a motion to approve the amendment as presented by Mr. Rizzo?
It's not an amendment, it's just the presentation as it was presented tonight. It was the original motion that's on the agenda tonight. It's just the only difference from what you, well, it's the amendment to the health and safety plan, but it's not an amendment to this action item. So we go back to just what was recommended tonight.
So many motions and amendments. Okay, so we're just going back. Is there a motion to approve the presentation or what was presented by Mr. Rizzo for the amendment to the AGES Health and Safety Plan? Is there a motion for that? Which all it does is the same plan that was just presented, but keeps the date of September 24th. So we don't have a motion?
So
we don't have a-
moved. I'm so moved. So moved.
Second.
I'll clarify when.
And you called a second. So are there questions or comments about this? Any further questions or comments about this plan?
Yes.
Go ahead.
So what's on the table right now is as Mr. Rizzo presented.
Correct.
As is.
As is.
No changes.
No changes.
Okay.
Any other questions or comments? All in favor of this plan, say aye. Aye. Any opposed? This motion passes. We're going to take a 5-minute recess. Adjustments that are being made to the agenda this evening. So we are going to postpone our second presentation by Mr. Rizzo tonight on the administration restructure proposal. We're going to postpone that till September meeting. I also ask for you to hold the board and committee reports until the September meeting. And regarding public comments, at the close of the meeting, I'm going to cap it at 1/2 hour, take 15 minutes from people on Zoom and 15 minutes from people in-house, and ask you to restrict your comments to anything other than masking at that point. So with that, Dr. Murray, if you want to go ahead and present on the Summers RAM program, we'd like to hear from you. Thank you.
Sure, thank you. I'm very proud to share a brief update on the Summer Rams program. With me today is Sarah Toback, who was instrumental in this program as the 5 to 8 coordinator. I'd first like to thank the board for supporting this program in April. At that time, I presented the program with a proposed budget with the funding coming from ESSERS. Not only did we stay within the projected budget, but I want to share with you some successes as well as lessons learned for improvement. You can just click me ahead, just to advance, it would be great, thanks. So as we get caught up, I'm just going to continue if that's okay. As you recall, we offered 3 options this summer. We offered a fully asynchronous option, virtual options, and an in-person options. We certainly know the challenges of last year, and not only did our staff do a fantastic job getting through the last school year with a lot on their plate, ending the year tired, I have to give a huge shout out to our staff because they really stepped up and came through big time during the summer. Throughout the Summer Rams program, we had 83 staff members participate, 69 teachers, 3 nurses, 2 Summer Rams coordinators, 3 building level supports, 4 curriculum department staff, and 2 resource officers supported our programs. We offered 3 sessions, as you know. Session 1, we offered 14 in-person sessions. We offered 35 virtual sessions. For session 2, we offered 18 in-person sessions and 36 virtual sessions. And for session 3, we offered 16 in-person and 25 virtual. Our enrollment was amazing. We did anticipate lower enrollment for grades 5 to 8. That was something that we knew coming in, but we were also able to offer, again, the math in person, ELA in person, virtual, both math and ELA. With a total number that you see here, this is representing the seats. There were students who took advantage of all 3 sessions. And what's great is at the grades 5 to 8 level, we did not have to turn away any students. If a student wanted an in-person session or virtual, they were able to get a seat there. So total enrollment seats, we offered 81 in person and 172 virtual. Grade K to 4 is really where enrollment expanded and boomed. If you recall, we actually added on additional sections for kindergarten, 1st and 2nd grade. After the enrollment process, it closed within, I believe, 7 minutes for some of our younger grades. So we were able to make some last minute changes and add on some additional kindergarten and 1st and 2nd grade class. Our total enrollment here again represents the total seats. We do have students who took advantage of all 3 sessions. We had 376 in-person seats and 546 virtual seats. So So the total scope and impact of the program, we were able to offer 457 in-person options and 718 virtual options for students. So certainly we're reflecting back now at this point, looking at what worked and what didn't, and looking forward to possibly offering this again in the future. Certainly some of our glows are our staffing and our enrollment. It really surpassed our expectations, and our teachers were really on board big time. We were able to offer a lot of small group instruction and individualized attention for students who really need it. As you recall, we used the iReady program this year, which was a new platform for us. We received a lot of positive feedback from our teachers regarding that platform, and not only do we have a lot of success using that, but it's not all the time that we get to kind of preview a program such as iReady before actually adopting it. What we really liked is the ability to assign specific content based on student needs. We had an individualized learning path for students who needed it, and there was also a teacher toolkit with digital content and lesson plans. There were some challenges with iReady that we were working through as well, trying to improve that. For example, some students didn't complete the assessment till the end of May, and we didn't have as much data and long-term data as we would like for this. We are continuing to explore options with iReady as a resource. In fact, I'm hoping to share at Curriculum Committee this upcoming month some of our more specific successes with iReady and potentially some plans that we could use iReady moving into the future for the upcoming school year to help address student learning loss. It is one of those resources that appear on the PDE Resource Center, and it's something that we could potentially use for ESSER funding in the future to help support that. So it's something I look forward to talking to a little bit more at Curriculum Committee. In reference to some of our grow areas, we do need to look at improving the registration process. It ended up being a little clunky. We had a lot of changes that our coordinators really worked through to make sure that we can get all of the students where they needed to be. We did get some feedback that we can improve communication, especially early on. By the time we were offering the session, a lot of families had already made summer plans. So if we are considering this in the future, we want to be able to communicate earlier to our families so that they can make plans. Also considering limiting our enrollment to our highest need students. This is not a priority for us going into this past year because we knew that that term need for our families meant very different things. We wanted our families to be able to determine what their need was. So we had a wide range of academic needs, social emotional needs, students who hadn't been in school for a while or in person. Getting the opportunity to get acclimated again was really a great opportunity. And finally, one of our grow areas is really making sure that with the diagnostic assessment with iReady, we know it was a challenge doing it at home. So that would be something that we would look forward to changing in the future. With that, I'm going to turn it to Sarah Toback just to share a little bit of the student experiences of the program.
Hello, good evening. I would invite you to look at the screen to see in our students' words some things that they certainly got from this program. At the end of each session, I had the students, grades 5 through 8, reflect on their experience. Because for me, it's not enough that they just reviewed reading and math, but I want them themselves to look back on their learning experience and see really where they improved and what they are capable of doing, even in such a short amount of time. So for my in-person students, you'll see in the next picture a lovely picture of me with Rowdy Ram. And our in-person students wrote on individual cards where they felt they improved. And on the previous slide, the virtual students wrote things on a Padlet so they could see what themselves and their fellow classmates improved upon in just a short 2-week time. One thing that I really like about this is how specific a lot of students were, because due to iReady and its ability to allow teachers to differentiate easily, students' needs were definitely met here. So not only did students just get better at reading, but they got better at reading with purpose. They got better at reading and finding a point of view of character diagnostic and so on. So I think that is something to really take from this. One, just student growth, and two, how they were actually able to pinpoint exactly where they improved and made up learning losses due to the pandemic. Thank you.
So with that, I just have a few bits of data to share. We did send out a survey to our teachers, just reflecting on the experience and reflecting on iReady. Again, I'm going to share that at Curriculum Committee coming up. But for our families, I really consider this to be a great win. 91% of those who participated in person strongly agree that the sessions helped address their learning gaps, and 96% agreed or strongly agreed that their child enjoyed participating, which is really spectacular for a summer program. For the virtual feedback, we saw something very similar, with 93% agreeing or strongly agreeing that they closed the learning gaps, and 97% agreed or strongly agreed that their children liked participating. We did also ask whether or not it met their expectations, and we did see that 95% of in-person met their expectations and 89% of virtual. So what's next? We are continuing to evaluate iReady. Again, that's something I shared in the beginning, and I'm looking forward to bringing more information specifically about iReady to Curriculum Committee. There were a lot of strengths of the program that we want to maybe look at continuing and seeing if we can go on throughout the year. I am in process of really negotiating with the publisher as much as possible, because it is a very costly program, but we did see a lot of successes with that. And with that too, looking at future discussions as to whether or not we would plan this again for next summer, one of the major changes we would want to do is plan early. Again, our family, some of the feedback is that it was a little bit too late in the end, and they had already made plans, camp, so forth. So if we were going to do this program again next year, we would want to plan early and get that communication out early. Any questions?
Kelly, Dr. Murray. So in your assessment, it was a success?
It was. It was a great opportunity to get that individual attention. Did it close every single student learning gap? Of course not, but I think it provided targeted instruction for at least some.
Well, I mean, I agree with the parents that it, was kind of planned later, but again, we didn't know.
Yeah.
But this was all paid, this year was paid by the ESSER money, correct?
Correct.
So the endless bucket of ESSER money. If we want to plan and try to do this again next year, this would have to be funded by Springford, correct?
Not necessarily. With the ESSER money, we have about $900,000. I'm looking at Jim to make sure I'm correct. That is earmarked for specifically for learning loss, and it has to be used for learning loss. So one of my thoughts is to maybe pull in iReady throughout the year, and that can go towards that bucket, or if we continue this program next year as well, that could also come from that bucket. But we have a lot of red tape with what the learning loss is considered under the ESSER fund, but I think it would qualify.
That's also the same 900,000 that's allocated for social emotional. No, is that different? So that $1 million is separate from this. Okay, so then you still have a 900,000 that we could use for next year for learning loss.
Correct.
Okay, great.
Well, we start with 900,000. This came out of that first bucket, so we would have the remainder of that, which would be about 600,000.
Right. Okay, great. Thank you.
Dr. Murray, thank you, by the way, and for all the teachers that participated. So I was just unable to follow, like, student-wise. I know you were talking, there were 3 sessions, right?
Yes.
And there were varying numbers, but do we know, like, just from an impact standpoint, like, how many individual students that this really translated into, or what would be your?
Sorry, I didn't mean to cut you off. We don't yet, but we need to dig in to get that. That's part of that registration process that it became very clunky because we had about 625 families, and then we had to go through each of the individual rosters. So we can get that, but it's going to take us a little more time to dig to see how many individual students, not just seats. The seats were a little bit cleaner and easier to get.
Okay, thanks.
Great, thank you.
Thank you, Dr. Murray. Thank you for all of your hard work on that, and we'll look for more information as we get closer to the end of the school year that we're just starting. So thank you for that. Okay, so now we're going to move right down. Student reps, Mrs. Melton and Mr. Fitzgerald, are you good to move?
We had no meeting.
All right, so then we're going to move to the minutes. A and B, is there a motion?
So moved.
Second.
Questions or comments? All in favor, say aye.
Aye.
Any opposed? That motion carries. Personnel, A through P, is there a motion?
So moved.
Second.
Questions or comments?
Brief comment, just would like to acknowledge there's a lot of great educators that this district's losing via retirement or other means, and I would just like to thank them for their service, and I just wanted to acknowledge that briefly.
Thanks, Mr. Schaefer. And I will say that Ms. Lisa and her department has been working very hard to get all of our positions filled. So thank you for those heroic efforts. I also want to welcome Colleen Slavin in advance, one of our administrators now at the 7th grade center. So we welcome her to our team.
All right, thank you. All in favor of A through P then, say aye.
Aye.
Aye. Any opposed? That motion carries. Finance, A through J. Is there a motion?
So moved. Second.
Questions or comments? All in favor, say aye.
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 Any opposed? That motion carries. Property A. Is there a motion?
So moved.
Second.
Questions or comments? All in favor, say aye.
Aye.
Aye. Any opposed? No, that motion carries. Programming and curriculum, A through D.
So moved.
Second.
Questions or comments? All in favor, say aye.
Aye.
Any opposed? That motion carries. Conferences and workshops, A through F.
So moved.
Second.
Questions or comments? All in favor, say aye.
Aye.
Aye. Any opposed? Mr. Jackson, I'm sorry, did you say no? Okay, that motion still does carry. Other business, A through F. Is there a motion?
Second.
Questions or comments? All in favor, say aye. Aye. Any opposed? Motion carries. Any board comment?
Yeah, just a couple comments, real quick. A lot of information was presented this evening from, a lot of parents and that, which was good, but a couple things that I think we still need to figure out, which we don't get direction from, is what if kids had COVID and they're not wearing a mask, for instance, do they still need to quarantine? I don't think that question's ever been answered by the county in their quarantine. I might have missed it. It was mentioned several times that, or not several times, it was brought up about, kids with special ed, with IEPs, and, are there services, and again, Mr. Russo, you don't have to answer any of these this evening, but special ed kids with IEPs, if they have to quarantine, how are their services going to be addressed? And maybe that's something that you could present to the board, or at least put some, have a position statement by the district that's readily available for parents, because that's a great question. There was also mentioned, which is 100% accurate, about mask standards. I think that that's something that we should look at and have available, because as I listen to parents get up this evening that were wearing masks, and some of them aren't even actually wearing the mask properly. And if parents aren't wearing the mask properly, how do we expect our students or our kids to wear them properly? We need to make it reassure, because what I'm concerned about is what happens with quarantining or contact tracing. How do we know if a kid's actually wearing their mask just because it wasn't pulled down over their nose or over their mouth for a long period of time? I mean, these are all the things that the county didn't really address when they came out with their quarantining, contact tracing. But we all know that the teachers spend a portion of their day making sure that the students are wearing their mask properly. So from a quarantining standpoint or contact tracing standpoint, we really don't know if a student that was affected, if they're actually wearing their mask properly the entire day. It was suggested about N95 and KN95s. Those statements were actually accurate. And it's something that we should be looking at as a district. That, is that something that we can make available? Maybe we work with our the government, the state government or federal government for funding to have these masks available for our students to wear, instead of, as one parent mentioned, about, the T-shirt that's tied around their face or whatever it may be. I mean, so there was a lot of validity that was brought up this evening, and we these are things that we should look at. But mask standards, types of masks, this is all plays a very important role into requiring or talking about masking in the district. That we do, and I just want to reiterate that we do meet all the social distancing in the cafeterias during lunch. Is that correct?
Yes, that's correct.
Okay, and then you did bring up about the quarantining or social distancing if a student is out anywhere between 3 to 10 days, whatever period of time. I brought this up. I asked this before. I asked this last year during the school year as we were ending the school year. I do have a concern about learning loss with students if they have to quarantine, not having access to be able to, and I liked somebody made the recommendation of at least possibly opening up a Zoom room that the teacher's not necessarily virtual teaching, but at least that the student could still listen or participate. Not necessarily, let me get that right. Maybe not necessarily participate in the class, but maybe open up a Zoom room where they can at least listen and see the lesson being taught. I just don't, I understand what Ms. Ritter was talking about, keeping the kids in school, that virtual had its limitations and negative impacts on students. But on the flip side, asynchronous learning for 3 to 5 days as well could have a negative impact on their learning. So it's something to think about. And I don't know, I just want to clarify that we're not, as a school district, the there's 2 Department of Health in Pennsylvania. There's one at the state and there's one at the county. They are ultimately responsible for the health and well-being of all the residents within the state of Pennsylvania. It's no matter what, it's still what pushed down to the districts where they put us in to make these decisions. Was somebody used the word dereliction of duty multiple times on us. Well, to me, it was the dereliction of duty by both the State Department of Health and the County Department of Health. And as far as the state representatives, if somebody mentioned one of them that sent out a letter, that same letter that was sent to the school boards was sent to the media. So this was just a political stunt, had no impact on the only reason was political stunt. And just like the letter that we got today from another representative, the only state representative that I could say that reached out to me, and I as I heard Colleen say, was Representative Cerisi, who actually said, what can I do to help? He was the only one. I don't need to be lectured by Senator Muth, and I don't need to be lectured by Representative Webster, and I don't need to listen to Representative Schusterman telling parents, well, we can't decide what to do with the state, so the school boards have to. Representative Cerisi was the only representative that at least contacted, I don't know who else he contacted on the board, but he at least reached, So he reached out to multiple board members, and he specifically said, what can I do to help? Which is a huge difference than a few people lecturing me that I will not listen to with their lecturing and their political positioning.
Well, maybe we can contact those representatives now and see if they'd be willing to support funding for some
I have no
N95 masks.
I think that's a good point. I mean, there's a good example if they want to help funding of KN95s or N95 masks that we could have available for our students so they are properly masked. And we could set up standards so we could actually demonstrate the proper use of the mask in the schools. And Ms. Wright, I'm sorry that Mr. Cerisi, Representative Cerisi didn't reach out to you, but I didn't say he reached out to all board members. I said he specifically did reach out to me and apparently some other board members.
I was just clarifying that he did not reach out to me.
Okay, are there any other board comments this evening? Aside from everything else we've spoken about tonight.
I'd like the board to consider taking the Zoom that we use for committee meetings and cease to have those in operation. It is a big impact on our local staff to put those productions in place. And for the last couple of months, I can speak for property and finance. It's 1 or 2 people on those calls. I think we need to look at the impact that it's having on the staff to put those productions in place. It's a lot for not having people on those calls.
Mr. Fitzgerald, were you going to look into how we first started to use Zoom during the pandemic and what procedures, if any, we would need to follow to stop using Zoom?
Yes, the question was presented earlier to me. I will need to look to see how we set this process up back at that first meeting, I think in late March of 2020. If that was simply done where we just started a meeting, Zoom, and we were off, then I think we can do it fairly easily. If there was a motion passed at the time, I'll need to see what limits were put on it. Bottom line, I'll get that direction to you. It may be simply as easy as the board saying we're ready just to move back to regular board policy.
I think that what Mr. Jackson is referring to is making a motion or making a recommendation to just eliminate Zoom for committee meetings, not board
committee
meetings.
meetings? Oh,
Just
if it's
committee
just
meetings.
committee meetings?
Just
Yes,
committee
committee.
meetings.
That proliferated, if you would, independent of what the board did. So I think that can be done.
Right.
That can be done just simply by a board support of that.
Well, I support Mr. Jackson. There's a lot of effort that goes into the entire setup. For most times, there's no one on.
Last couple of months.
Right, so I support that.
Are you still going to get us the information, though, on the general board meeting?
On what the board did for its regular board meetings and workshops, absolutely.
And I should know this because this is my 3rd term. For board members that would like to, will there be like a dial-in option to be able to listen to what goes on in committee meetings? I think there used to be, or because by the way, I appreciate that. I think that Zoom, was needed, and I'm not sure that it's needed now. So it seems like a burden. And so I just wanted, because there are times I travel a fair amount for work, so that I do appreciate the option of dialing in or gaining access to participating without being there.
Well, we used to just have a conference bridge set up. If a board member couldn't attend a meeting, we used to just have a conference bridge. But which is simple. It takes a couple, but for Rich or whoever to do the entire setup for Zoom for a committee meeting for one person, or sometimes nobody, most times nobody, so I support what Mr. Jack, I support that recommendation.
My only suggestion with the committee meetings, we may want to just simply advertise that it's going to be just now in-person meetings exclusively. I do believe when I worked with Diane on the advertisements, it noted the Zoom option. So we might just need to re-advertise the committee meetings.
If we're all going to give that direction, correct?
Correct, if that's
Okay.
if that's the will of the board.
Seems like it's coming this way. What is the thought process there?
For committee meetings, I'm comfortable. I think similarly, my experience is there's very few, if any, folks who attend the committee meetings outside of board members. There may be a 1 or 2, but very, very rare.
I agree.
Okay, so I disagree, but the majority of the board agrees, so we'll get rid of them for committee meetings. Okay, any other board comment? If not, we're going to move on to the last segment of public to be heard, and I will reiterate that we are finished discussing masks. So if it's a topic other than masks, other than masking, that you wish to discuss, there will be 15 minutes in person and then 15 minutes on the Zoom, and we will call it there.
Rebecca Daniels, 1211 Meadowview Lane, Montclair. Equity, diversity, and inclusion. Doesn't it sound wonderful? So let's redistribute the wealth among the people so that there is no rich nor poor. Under this ideology, the young and brave men fought and died for North Korea 70 years ago. Look at the country now. Its majority citizens are poverty-stricken, where their government enjoys the wealth. Its counterpart country, South Korea, boasts 12th largest GDP in the world. How about East Germany? Their socialist policies led to economic stagnation, political oppression, and widespread dissatisfaction among the people of East Germany, which led to German reunification in 1990. You and I are the witnesses of such history with our very own eyes. How about China? It's doing pretty well economically, one might say, but I know this. If its citizen speaks against CCP, you can possibly disappear. How about living in such a place? By the way, CCP has enough information on every US adult to use it against us. No, of course that's not true. That's a conspiracy theory, one might add. Amanda Wenagat, an award-winning manager at Starbucks, decided to quit in this past June over this wonderful equity culture that led to bullying and division. My point is how much innocent and well-intended this EDI movement is. The end is division, hate, and racism, as history has already told us. Let's talk about race and color. I'm Asian and have yellow skin color. If anyone does not like me or even bullies me, is that person a racist? Years ago, a stranger in a passing car gave me a chinky eye. I refused to feel sorry for myself, but did feel sorry for that woman as a young girl as I was at the time. I live in great America where there is least racism and where every minor group is protected under civil rights. My husband is black, and we have one John Legend looking like son. When he was about 3 years of age, a 4-year-old precocious girl asked me where his mom was when I was right in front of them. Now, is that child being a racist? My black husband is a gentleman and is well-liked and respected by everyone, including his all-white colleagues. He tells me that his white colleagues trash talk about Hispanics, other blacks, and even whites. Per my husband, this is not about racism, but about human sinfulness, and I agree. The fruit of the Spirit is love, joy, peace, long-suffering, gentleness, goodness, faith, meekness, temperance. Against such, there is no law. Thank you.
Okay, thank you. Do we have anyone else this evening?
Abby Deerdorf, 704 Collin Court in Royersford. Thank you, Rebecca, for kind of giving me an opening to what I wanted to say here tonight. It's been a pleasure and an honor that several students have reached out to me along with their families about their experiences here at Springford with school board meetings, with EDI, and all of the above. And I wanted to tonight, as a parent, as a community member, apologize to Sana, who spoke tonight as a student, because when I met her in the hallway to say hello to her and her father, she told me that there was remarks being made to her to go back to where she came from in this room while she was speaking about her experience here at Springford. So you cannot sit here and tell me that EDI, CRT, whatever you want to call it, is something that I'm bringing to the district and causing problems with when it happened right here in this room tonight. Right here in this room. And it happened last week too when Allie Belair spoke. There was snickering, there were comments being made by adults to children who had the bravery to come here and speak to you and the community about their experiences. So don't tell me this is something new and something that doesn't exist, because it's here. You approved your EDI policy unanimously last year. There was never an issue over it. There was no conversation. There was no Facebook post, no backward comments. It's happening here. It happened here tonight. I apologize to Ali and Sana. It takes great bravery to come speak here. I know there's parents that don't feel comfortable speaking here, that parents don't feel comfortable speaking on Zoom, and that have thanked those of us that do have that bravery and courage and whatever to come out and do it. And those are the voices, the students' voices are what should be elevated. They are the ones having this experience, not you, not me. None of us are there the way that these students are. And to disrespect them to their faces while they have that bravery and courage, it's disgusting. And so for that, I apologize. And I promise to be a voice to everyone. Thank you.
I have to comment.
Yeah.
Let me,
Campaign speech.
no, just hear me out. If something happens, someone needs to bring it to the board. No, Abby, I'm okay. I'm trying to talk to everybody. If something happens in here and no one tells us, we're hearing about this now, right? Something happened last week. We're hearing about it now. Yeah, I'm not talking to you. I'm talking to everybody, because we hear that Springford has these issues, and Springford is no different than the world as a whole. There are issues, but if the issues are not brought forth to the board, how can we act on them?
I agree.
Something happened last week. We hear about it 12 o'clock a week later. Something
how,
happened.
Hold on, we'll give her her last 44 seconds just because she had said, but go ahead.
I agree with you 100%, but the contentious air is not comfortable for people. Okay, so like that is on them. But I, as an adult who was informed that this happened, is apologizing to her publicly in front of all of us who are adults, educators, and professionals, and allow it to sit here and happen. So I'm apologizing to her with my 25 seconds.
I'm just surprised her father wouldn't reach out to Mr. Rizzo while he was here. I'm just trying to understand.
So in the middle of a meeting, you want a parent, when there's
No.
very rules, there's people yelling and snickering at everything people say, and then as someone who has never come to a meeting, never spoke before, they're going to walk up to Mr. Rizzo and say, what is this going on? Like, what is tolerated and what isn't?
Let's
So
close this comment and let's move on to the next one.
Mr. Jackson, I'm going to just respond to you. The student did approach me today, that based on today's occurrence, before she left. She shared with me some of her concerns. Of course, certain things were happening in the audience that are certainly out of earshot for us. And I asked her to please reach out to Mr. Rizzo, and I also shared what she had shared with me with Mr. Rizzo. It was not an appropriate time to share it at the board level as we were in the process of various deliberations.
Would prefer, the student is not here, and I would, let's allow whatever occur to occur on the student administration level. It's really not something that we should be discussing publicly.
All right, thank you. And then we'll move on, please.
This is my first meeting.
Can we ask you just to speak into the mic, please? So
Sorry.
You can move it up if it's, yeah. And then if you could state your name and address, please. Thank you.
Melissa Shore, address 260 Washington Street, Royersford, PA. I wasn't going to speak tonight. This was my first time coming here. But I kind of just wanted to make a more positive comment and say thank you all for what you do. Me and my family moved up here in 2019. It's been a tough year. But I've always been taught to be very positive and move forward in spite of my environment, in spite of who I come in contact with in any situation. And I feel like tonight, sitting here, there was just so much like just hate and just the vibe and the rudeness and just like everybody's adults in here. And I have a 15, a 13-year-old, and a 1-year-old. And my husband is a Caucasian, and I don't know. I just was never raised to ever, and I have a grandmom that grew up in Birmingham, Alabama. So again, being African American, all this stuff is always put in your face and always thrown in your face. And if you don't react to it, then you don't care about it. But I say all that to say, I would like to see maybe some more diversity. And I'm not going to come up here and yell and scream about it. I want to be more proactive and say, as a parent and having my kids come here, and how can I help? Which you don't hear that a lot. People just come up here and complain and yell and but it's like, okay, we have an issue. What can I do to help? How can I help? And be positive about it. Like, it's ridiculous. These grown people are up here yelling and screaming and mass and people are dying. Like, calm down. Like, I need y'all to calm down and really focus on what the issue is. People are dying. I have asthma. I wear my mask. I've had pneumonia 3 times. I haven't gotten vaccine yet, but that's my business, and I'll decide when I want to do that, when I want to do that. But again, with everything going on, I just feel like people just need to calm down and just remember just to be, and I don't mean to sound adolescents, but just be kinder. I don't know. It's just crazy. You know, it's my first meeting, and I do plan to come to more because my kids go here, and I want to be active, and I want to get to know everybody. And me and my husband are very peaceful people. So, you know, any ideas as far as like, how are we going to help our students with everything that's going on, help them, you know, just different things. Like, I don't know, at work you have wellness programs. I don't know if there's something here that you guys are considering to help the students maybe get through situations, but just things like that. I just wanted to say thank you, and I'm here to help as a parent. So thanks.
Thank you.
Attorney Patrick.
Okay.
So I just wanted to understand what lip service this school board was going through, because in the beginning of the meeting, we sit here and we say, first thing is the Pledge of Allegiance. And I just want to say.
Is this related to the masking issue?
No, it's the Pledge
What
of
is it related
Allegiance.
to?
It's the Pledge of Allegiance. That has nothing to do with the mask.
I'm sorry,
okay?
then what's your comment?
I'm making my comment. So we got up here and we talked about, we said the Pledge of Allegiance, right? Each of us, we stood up, we put our hand on our hearts, and we said the Pledge of Allegiance. So I want to say that the definition of liberty, I don't know how much clarity you guys have about that, but it's the quality of state of being free and the power to do as one pleases, freedom from physical restraint and freedom from arbitrary and despotic control. So I'm just wanting to let you know, like, was that just lip service? And someone else in the audience had given that to me and asked me to present that to you. Thank you.
Go ahead, sir.
Volodymyr Staruschak, 136 Larchwood Court, Collegeville. I would like to make a small comment about the way that we did a survey, and maybe going forward we can make a small adjustment. I give you an example. I have one daughter we should go to the 4th grade, and my younger one will be a kindergarten student. In the survey, I was able to determine what kids in grades 7 to 12 will be wearing or not wearing. I believe that's not very fair for me to make a decision for the building that my kids will not go to. And it goes another way as well. So imagine probably many parents who have just kid in the high school, completely separate building from the Brook Elementary where my kids will go. Somehow they were able to vote either when, on the survey, if my kids should wear a mask, be mandated, required, optional, and any of that. So maybe going forward, we can only, make it possible. I believe it should not be that hard. I work in IT, and your team probably sophisticated enough to, make some logic, to apply policies and be able to make parents to vote only for the policy that will affect their kids and not somebody else's. Also, I didn't read on the other items on the agenda as far as race and what educate and what not teach our kids. My lesson and that I learned by immigrating to this country and raising 2 kids here, my kids, we live in very diverse neighborhood. They go to the karate class, and it's like representative on any race or combination of races possible in their classes. The same goes into my development. I live in Perkiomen Woods. No, not one time I've heard that my kids were in disagreement, liked or did not like someone because of their race or income level of their parents. It didn't come up once. So maybe we should take a lesson from our kids, how to behave in situations like that, how to just be human and take, for whatever you are. If you're a jerk, no matter what race you are, you're a jerk, and we should call it that. If I like you, no matter what race you are, I like you, and we'll be friends. maybe we should take a lesson from our kids and not tell them how to behave. They're already doing fine on their own. Let's not screw up their minds with some nonsense and just, put our thoughts, faulty thoughts into their heads, perfectly fine heads. Thank you.
Do we have any on the Zoom? All right, go ahead, Aaron.
Kim Anderson, you may now make a public comment. Please unmute yourself, then state your first and last name as well as your full address.
Hi, Kim Anderson, 123 Patriot Drive. Colleen, I'm not sure if you were saying we cannot state public comment at this time on masks. Is that what your statement was earlier? I'm a little bit confused.
Yes, it was at this time.
Okay, I'm going to continue. Okay, I'm going to continue. You can cut me off. I did not speak earlier, but you guys made a very major change in your vote tonight from 1 week ago, and this is the open public comment that's not related to agenda items. So I do feel it's my opportunity to make a quick statement. I will try to keep it brief. I do want to express my disappointment in tonight's change of vote. Nothing changed except public pressure in the last week. You guys, a couple of you made very, major statements about where your positions were, and nothing's changed from those agencies recommending, not requiring. My 12-year-old did not thank me initially upon my return home after my commentary and your 5-4 vote to recommend, not require, but an hour and a half later, he came down unsolicited, hugged me and said, "Thank you, Mom." When you have a 12-year-old going through what a lot of 12-year-old boys are going through, believe me, that is something you just rarely expect. And you have to really take into consideration what it took for him to come down and do that. Dr. Wright's comments last meeting, I posted about this, and I think many have conveyed it tonight, but the fact that we were voting about masks and she just wasn't really all that concerned about their efficacy or not, but how people feel about them was inappropriate. And I think she should have recused herself from the vote. Ms. Sullivan, I do have to make comments to you as well, because last week you were very adamant on your stand on that motion. And you then you said no, and then you asked to have it read before the vote. It was read. You still were confused on the vote. Everybody in the audience knew exactly what you were voting on, but nobody understood that. Luckily, the vote was still 5-4. However, that win was a 1-week win. We didn't even get to day one. So it was very short-lived. I wish some of you guys could come and explain to my 12-year-old now the change in this vote, because I don't want to do it. Mask efficacy doesn't seem to be of any concern. Go to the Old Navy website and read what their description is about the masks, because that's where most of our students are getting their masks from. I'm not going to read it. You can all go look it up. My comments last week, I did ask to allow teachers to unmask, formalize an indoor mask break policy. None of this has come up. None of it. Other school districts in our country have spent a lot of time in their school board meetings discussing this and adding it to the motion. Does not even come up here. That's a shame.
Okay, do we have any other comments on Zoom? Not mask related.
Liz Kepner, you may now make a public comment. Please unmute yourself and state your first and last name as well as your full address.
Yes, this is Liz Kepner, 19 Leatherwood Drive, Collegeville. I am calling in to make a request that the number of students who are forced to quarantine is included on the school district dashboard, so that there's transparency among the community about how many families are actually being affected by this and affected by the decisions of someone else not wearing a mask. Thank you.
Thank you. Do we have any other, Aaron?
At this point, there are no further public
Motion to
comments.
adjourn.
Second and meeting adjourned.